Om Shri Sai Ram. Let us start our today's session with invocatory prayer.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभा निर्विघ्नं कुरु मे देवा सर्वकार्येषु सर्वदा ॐ साईश्वराय विद्महे सत्यदेवाय धीमहि तन्नः सर्वः प्रचोदयात् ॐ शान्ति शान्ति शान्तिः.
I welcome you all to the World Diabetes Day Symposium. Today, we have gathered here to raise awareness and share knowledge towards the global fight against diabetes. World Diabetes Day is observed on 14th of November every year. It serves as a powerful platform to unite global diabetes community and raise awareness about impact of diabetes and better care and prevention. Our symposium today is centered around the theme given by the International Diabetes Federation to know your risk and know your response. I now invite our head of the department, Dr. M. Srividya Madam, to deliver the welcome address. Thank you.
Om Shri Sai Ram. Respected elders, teachers, research scholars, and dearmost students. Offering my humble pranams at the divine lotus feet of our beloved Bhagwan, I stand before you today on this significant day, World Diabetes Day. Diabetes, a global concern that affects millions of people or lives around the world, is a challenge that we need to address. So diabetes is more than just a metabolic disorder. It is a daily challenge that touches the lives of many communities everywhere in the world. It is very important that all of us recognize the alarming rise of diabetes cases globally. According to the recent statistics given by the International Diabetes Forum, over 400 million people are living with diabetes. This number is going to be increased, expected to raise to 700 million by 2045 if we do not address or take a decisive actions against this metabolic disorder. It affects people of all ages, that is children, adults, or women, irrespective of the sex, that is women or men, and also old people, and all walks of life. It can lead to serious complications and also impacting the quality of life, and in some cases proving fatal. So this diabetes, the perspective towards diabetes should be changed. This is what is the challenge that we need to address. It is not merely a health issue, it is a societal challenge that demands over attention, understanding, and collaboration at different levels. Today, World Diabetes Day, which is celebrated with a topic or that is the problem raised, know your risk, know your response. So on this occasion, with the initiative taken by our Professor and Director Srividya Madam, a symposium is organized by the Department of Food and Nutritional Sciences. We have with us our external expertise, Ira Madam, and our honorary professor Andallu Madam, who has worked in the area of diabetes, and also our Professor Srividya Madam, who will be addressing us and sharing their knowledge regarding the various issues that come with this problem. So, we come together to raise awareness for understanding and promoting a collective commitment in combating this silent epidemic. It is an opportunity for us to educate ourselves with the risk factors, symptoms, and preventive measures associated with diabetes so that it will be helpful to us, to our family members, and to our neighborhood. As we observe Diabetes Day, let it be a call for action and not just understanding and listening and sharing our expertise, but also we should go for call for action for our collective call for action with our friends, with our families and societies, and let us strive for a world free diabetes, because diabetes is not a barrier for to fulfill a healthy and a quality life. So by listening to the expert, all of us come together through education, awareness, and advocacy. We can prevent new cases and also support those who have affected with this problem, and ultimately finding a solution and also reduce the risk of this problem. So without further delay, we will start the session or the symposium. Thank you, Sairam.
Thank you, madam. Um, Now it's time for our first session by our ma'am, Professor B. Andallu, ma'am. Ma'am is an MSc in Biochemistry from Andhra University and PhD from Sri Krishnadevaraya University, Anantapur. Since 1986, serving Sri Sathya Sai Institute of Higher Learning, Anantapur campus, ma'am has been former HOD, currently a professor, honorary professor in Department of Food and Nutritional Sciences, recipient of many awards and gold medals at national and international levels. Recently, ma'am has received Chelaram Diabetes Foundation Research Award. Ma'am has authored 6 books and 12 chapters for books including Oxford Press, and has published more than 60 review and research articles, delivered talks, and presented more than 100 research papers in national and international conferences in India and overseas. Ma'am has also visited many universities like Texas Tech, Houston Clear Lake, Maryland, Savannah State University, and have delivered guest lectures in USA, South Africa, Sri Lanka, and completed research projects specialized in research on natural remedies for stress-induced diabetes. Ma'am has also guided 50 MScs, dissertations, MPhil and PhDs, and ma'am has over 2,000 Google Scholar citations. Ma'am is a former member of editorial board for Annals of Phytomedicine, reviewer of scientific journals, and life member in professional bodies like Indian Science Congress, Indian Pharmacological Society, Society of Biological Chemists, India, and Nutrition Society of India. We welcome you, ma'am, to deliver your talk.
Pranams at the lotus feet of Bhagavan Baba, founder chancellor of SSSIHL, respected director, Professor Srividya, Dr. Srividya, HOD of DFNS, research scholars, other faculty members, and my dear students. I am going to share my knowledge with you all on the topic diabetes, an overview. Before going to that, we listen to the quotes of great saints. I quote, "A healthy body and a sound mind is necessary to achieve success in life." Unquote. This is from Ayurveda. Mahatma Gandhi stated, the father of our nation, I quote, "It is health that is real wealth and not pieces of gold and silver." Unquote. Mahatma Buddha stated, I quote, "To keep the body in good health is a duty, otherwise we shall not be able to keep our mind strong and clear." Unquote. Our dear founder chancellor says, I quote, "Keep your home and its environment clean. It will ensure health and happiness for you and for the society." Also stated, I quote, "Healthy body will have healthy mind, wherein healthy spirit will be there." Today, we are contributing or celebrating at our level to the World Diabetes Day. In this context, it is appropriate I speak on various aspects of diabetes. I thank the director and DFNS for giving me this opportunity. And these are the topics I am going to cover in this presentation. We'll see what is diabetes. Maybe very basics I am including just to benefit the students. Some of you are aware. To remind you again, and those who do not know, to make them know about it. Because it is a burning problem now across the globe. Diabetes is a chronic metabolic disorder of multiple etiology, wherein the body cannot utilize glucose completely or partially. It is characterized by raised glucose concentration in the blood and alterations in carbohydrate, fat, and protein metabolisms. When glucose is not utilized, the levels will be raised in the blood, thereby all the metabolic activities will be disrupted or impaired. It occurs because of the defect in insulin secretion or release or action. According to International Diabetes Federation, 463 million people had diabetes worldwide, of which 77 million are from India. 1 in 6 people in the world with diabetes is from India, and it is the 7th cause of early death in the country. India is now noted as diabetes capital of the world because of a number of factors. Some maybe we will cover in this presentation. According to the International Diabetes Federation estimates, India has the second highest number of children with type 1 diabetes after the United States. Asians have 2 to 4 times higher risk of type 2 diabetes compared to European states. Diabetes at least doubles a person's risk of early death. It doesn't appear the physical level, but physiological level, it will affect our body. From 2012 to 15, approximately 1.5 to 5 million deaths each year resulted from diabetes. Coming to the classification, we have a number of types, type 1, type 2, gestational, secondary diabetes, maturity onset diabetes. Each category, we have a brief note about. Type 1 diabetes, T1DM nowadays it is indicated as, to brief it. It is due to insulin deficiency. It usually occurs in the younger age group, also known as insulin-dependent diabetes mellitus or juvenile onset diabetes. Etiology, autoimmune disease, unfortunately, selective destruction of beta cells by body's immune system. You all know immune system gives protection against external antigens or invasions. But here, our own immune system will work against our body, which results in little or no production of insulin. Genetic factors, over 50% of the hereditability is contributed by HLA class 2 genes, because any alteration in our body at large will be connected with the genes. Coming to environmental factors, infections. Viral infection might trigger the onset of the disorder. This recently we have witnessed. Because of COVID infection, many people became diabetic. Moreover, the treatment was inevitable to give steroids to save the life of the affected person, and thereby some more have become diabetic. Some, it may be reversible, for some it cannot be. So now the number has increased for the past 2 years in Indian context or across the globe. Acute stress. Blood glucose may rise quite profoundly as the body releases adrenaline. Some of you know adrenaline is a stress hormone or epinephrine. Noradrenaline, cortisol hormones result in diabetic ketosis or coma, particularly among those with genetic predisposition. Already I told you, genetically these things are more aggravated. Genes play a very important role to control our susceptibility or to increase. And when these hormones are under stress, these hormones are secreted. They will trigger glycogenolysis in the liver. Thereby, glucose will add to the bloodstream. So, blood sugar levels will rise. Then it is being utilized. Clinical manifestations, polyuria, polydipsia, polyphagia. These are common for all types actually. Weight loss, weakness, dry skin, ketoacidosis. Excessive thirst, excessive hunger, excessive urination, and weight loss because carbohydrates are not utilized properly. Proteins and fats are utilized to meet energy demands of the body. Skin becomes dry. Ketoacidosis because ketone bodies are produced because of fats being utilized. We'll go to that later also. Type 2 diabetes. It is due to insulin resistance and or due to a relative deficiency in insulin secretion. Insulin may be produced by the pancreas, but if you see serum insulin levels, they will be all right. But its action is impaired because of the receptors, transportation of glucose. Many other points are there here. We are not going to very much in depth because to cover a lot of points. Develops slowly and usually it is milder and more stable. Once it occurs in our body, it will be almost like permanent. We can only manage. We cannot totally become non-diabetic. But now lot of studies, lot of information is available. But even then, you have to take lot of care to maintain your blood sugar levels. Once it starts rising, then it is in your hand how you will control. Mainly occurs in adults and usually when the person is overweight. Frequently known as non-insulin diabetes mellitus, non-insulin dependent, NIDDM or adult onset. Etiology, diabetes is a metabolic syndrome. Already I mentioned all the metabolisms are affected. Common people think only glucose is rising and no issue. There is an issue with all the metabolisms. Insulin resistance is associated with high consumption of refined grains, leading to a higher glycemic load. Nowadays, a lot of research has been going on with respect to glycemic load, glycemic index of foods, which to be included, which to be avoided, and the other speaker will be talking about the dietary guidelines. We are addressing the issue and the related problems. Type 2 diabetes mellitus is commonly associated with obesity, hypertension, and hyperlipidemia. One metabolism is disturbed. Lipids, generally diabetes is associated with hyperlipidemia, means hyperglycemia is associated with hyperlipidemia. Later we will go to those details also. Occurs mainly in subjects who are underactive and overeat. Obesity probably acts as a diabetogenic factor through increasing resistance to the action of insulin among those genetically predisposed to develop type 2 diabetes. Again, genes are coming to picture. Principally affects the middle-aged and elderly, 45 and above. Now, unfortunately, this age limit has come down. Above 30 also people are becoming, because of sedentary lifestyle and ready-to-eat foods and not following the dietary regimen. Because of busy schedule, people may support themselves, but ultimately we are all victimized. People with high waist-hip ratio have greater risk of diabetes. Because of sedentary, all the time sitting in the chair and working. Obesity, habitual physical inactivity, previously identified impaired glucose tolerance or impaired fasting glucose, hypertension, hyperlipidemia. Gestational diabetes. This is limited to women. During pregnancy, it can occur. Middle of pregnancy, it can be seen. Women who are overweight or obese may have insulin resistance when they become pregnant. Gaining too much weight during pregnancy may also be a factor. That is also lack of activity. Generally, people say, don't work, you have to take rest and all. Because of the things became very sensitive, doctors are advising to take rest. So all these factors are resulting in some cases, not everybody, gestational diabetes. This nice clinical practice recommendations report a number of GDM risk factors. They are the following. BMI is more. Previous macrosomic baby weighing. So earlier, first issue, overweight baby, overweight babies. Personal history of gestational diabetes. First pregnancy, probably she had faced that. Family history of diabetes. First degree relatives. Family origin with a prevalence of diabetes. Secondary diabetes mellitus. This is a bit different. Not very common. It can happen because of destruction of beta cells. You all know insulin secreting beta cells are in the pancreas. Alpha cells secrete glucagon, which is opposite to insulin action, and beta cells secrete insulin. Induction of insulin resistance by an acquired disease. Suppose already I quoted, because viral infection, acquired diseases, they result in destruction of beta cells. Other causes are for secondary diabetes: pancreatitis, infection to the pancreas, pancreatectomy, removal of pancreas due to some reason, carcinogenesis, or because of infection, malnutrition, endocrinopathies. Endocrinology, connected with our endocrine system, endocrine glands. Any problem there, it may result in this. Usage of drugs it becomes inevitable. When a person becomes sick, some drugs are given, but we have to try to overcome. Otherwise, these drugs affect. They have some positive sign to cure our disease, and negative, the other side of the coin, they will affect our normal functioning of the body. Chemical agents, toxins, many chemical agents, pesticides are entering our gut through food chain. Causes abnormal blood glucose, whatever may be the type, what you see is blood glucose levels are altered. Secondary diabetes may bring out primary diabetes in people who are predisposed to developing primary diabetes. Already they have a tendency, slowly they become permanently diabetic. Maturity onset diabetes of the young. A group of monogenic disorder, again genes are coming to the picture, characterized by autosomal dominantly inherited non-insulin dependent form of diabetes, mainly seen in young adults aging less than 25. This MODY, it is abbreviated as, is a rare cause of diabetes and is frequently misdiagnosed as type 1 or type 2. Causes. Common causes of maturity onset diabetes of the young is mutation in a single gene. You know, when mutation takes place in a gene, results badly in various directions. If a parent has this gene mutation, any child they have has 50% chance of inheriting it from them. So women have to take care mostly not being exposed to any mutagens in the environment or in the food which trigger mutation, and next generation will suffer. If a child inherits the mutation, they will generally go on to develop MODY before they are 25. Whatever their weight is normal, lifestyle is good, ethnic group, basically they are from a good ethnic group, but still they are becoming, because of mutation that has taken place during pregnancy, any of the parent, because of their exposure to mutagens, already I told you. Treatment. Often treated with oral medications or insulin injections. Depending on the severity, you may have to go for insulin injections. Some forms may not even require any treatment because no remedy. You have to only maintain. Another two categories nowadays we are hearing. Current WHO classification includes a major category of malnutrition related diabetes mellitus, MRDM. Under that, you have subcategories like protein deficient diabetes mellitus and fibrocalculous pancreatic diabetes. We'll go to the brief details. Protein deficient diabetes mellitus is characterized by its onset usually between 15 to 35 years of age, extreme degree of leanness, lesser than the required body weight, with a history of malnutrition in childhood, moderate to severe hyperglycemia, requiring large doses of insulin, and resistance to develop ketosis in the absence of infection or other stress-induced situations. Glucose-stimulated insulin and C-peptide release indicate a fair degree of residual beta cell function. We all know glucose, when levels rise, insulin is formed from pre-insulin by the removal of a C-peptide. So people estimate C-peptide also in the blood. If it is normal level, that means insulin secretion is good. Function is bad, rather. Their release indicate a fair degree of residual beta cell. So beta cell function became to the minimum level, thus providing a rational explanation of the combination of hyperglycemia without ketosis. So hyperglycemia with ketosis, without ketosis. Earlier type with ketosis, this is without ketosis. Ketosis, ketone body formation, I teach while doing the lipid metabolism. Because carbohydrates not utilized to meet the demand for glucose, gluconeogenesis triggers, lipids means fatty acids are oxidized. You get excessive acetyl-CoA that cannot be oxidized by a citric acid cycle. That much other intermediates should be available, but excess you are getting acetyl-CoA from fats. Glucose gives 2 acetyl-CoA. Fatty acids give n/2 number of acetyl-CoAs. So lot of acetyl-CoA we are getting. Suppose palmitic acid, 8 acetyl-CoA. All that cannot be utilized via citric acid cycle to give energy. It will be converted to acetoacetic acid, beta-hydroxybutyric acid, and acetone. These are ketone bodies. They accumulate in the blood because they cannot be utilized the rate at which they are formed. So ketonemia, excretion through urine, ketonuria, and the condition is ketosis. Because of ketone bodies, they are all acidic. Blood pH will decrease, leading to ketoacidosis. So now ketogenic diet, lot of encouragement, but I don't know. Personally, I feel it is not advisable. Ketogenic diet, carbs you are avoiding, taking lipids. And what about ketone bodies? Long run, these lipids will create problem towards cardiovascular diseases and so on. The other day, Dr. Mohan sir, the pioneer in the field of diabetes research, to a query online, he mentioned the same. Okay, ketogenic diet temporarily fine, but long run, you are giving lipids in place of carbohydrate and inviting problems towards heart functioning. But a lot of encouragement now. Everything, whatever it told, we have to have knowledge to understand and to implement. Take good out of total what is available. Fibrocalculous pancreatic diabetes is characterized by the onset of pancreatic disease during childhood with peak onset of symptoms of diabetes in the age group 15 to 35 years, moderate to severe hyperglycemia, requiring large doses of insulin for control, associated with resistance to develop ketosis on insulin withdrawal, constitutes the hallmark of the metabolic profile. Any type, metabolism is affected. Glucose we want for a lot of functions, energy. The same glucose when rises in the blood, it is toxic. So anything, Bhagavan says, in limit, anything is good. Beyond the limits, which was good also becomes bad. Whether it is your behavior, our food habits, whatever it is, should be under limits. Radiological evidence of pancreatic calcification confirms pancreatic cells get calcified. The diagnosis. There is usually a disturbance of exocrine and endocrine function of pancreas. See, you have endocrine glands, pituitary, thyroid, all this. But pancreas, you have endocrine and exocrine. Exocrine because it is secreting all the enzymes for proteolysis during digestion. Endocrine because it is secreting hormones. So dual role it is playing. It's a wonderful gland, very delicate. We have to protect it because a lot of functions it is performing. Monitoring of blood glucose. Most of you know, fasting glucose should be lesser than 100 mg per dl. If indicates normal, above up to 120, above 100 pre-diabetes, and 120 beyond they are diabetic. Random blood glucose, any day you will be estimating, that should be lesser than 140 milligram per deciliter. Above that you are pre-diabetic, still higher, above 160 you are diabetic. Oral glucose tolerance test, OGTT. After overnight fast, selected people, they will be advised to stop any other medications. Fasting blood glucose is drawn in the morning, 0 hour we consider. 75 grams of glucose is given to the patient with 300 ml of water after an overnight fast. Every 30 minutes, urine and blood will be collected and glucose levels are estimated. For 2 hours it will continue, and the subject should not have anything in between. They should be in the testing laboratory. For children, 1.75 gram per kg body weight is given 300 ml of water, unless until it is very essential. Children, it will not be done. Glycosylated hemoglobin. Hemoglobin, you all know, normal levels we have to maintain. Of course, various factors again. And glucose binds with hemoglobin, 4 to 6% it will be. Increase in the glucose in blood increases this factor. It is a better index. Our glucose levels are altered for every little emotion, food alteration, glucose levels are immediately altered. But glycosylated hemoglobin will not be altered. It is a better index. If you cannot judge a person is pre-diabetic, mild diabetic or severe diabetic, better we go for glycosylated hemoglobin testing. Of course, it is 450 above. So people cannot afford. They may go for blood sugar, but it cannot give clear picture. But every now and then we need not do. At least 3 months we can. Again we can do. Lesser than 5.7% normal, 5.7 to 6.4 pre-diabetes, above 6.5 diabetes. If we are controlling this, that means other problems are under control. Of course, this happens when blood sugar is under control. Glycosuria, after urinary threshold, 180 milligram per deciliter is crossed, glucose will be seen in the urine. Because kidneys cannot reabsorb, it will be filtered. But 180, you are diabetic, but urine sugar is nil. Sugar means glucose. You have testing. You can heat it, urine with Benedict's reagent. Or strips are available now. Just dip and see. Color comparison you do to know what level urine sugar is present. But remember, after crossing urinary threshold of 180 milligram per deciliter. Ketonuria, ketone bodies presence, uncontrolled diabetes, long term. Ketone bodies already listed, what are they, why they are formed and all that. They are seen in the urine. You can have testing for them also, just a strip you have to put in urine and color change will indicate the level of ketone bodies. There are some strips wherein glucose and ketone body both can be examined. How home level, need not go to any laboratory. This is diagnostic criteria. Already the levels which are normal, which are pre-diabetes, which are diabetic, that we covered already. Signs in general, signs and symptoms, changes, skin color, changes in body temperature, swelling in the foot or ankle, pain in the legs, open sores on the feet that are slow to heal or draining, toenails infected with fungus, corns or callus will develop, dry cracks in the skin, especially around the heel, because of our vitamin E, vitamin C. They are, because of the stress, they are modified, and normal routine functions they are unable to do because they are modified. So you have to have more to overcome the situation. Unusual and persistent foot odor. Some severe conditions, smell will be there, acetone breath. Because of acetone, acetone cannot be metabolized. The severe chronic patient will be exhaling acetone. So if you sit by the side, fruity smell you will get. That is severe condition and to be hospitalized for treatment. People who consume alcohol, simply people for fancy, social drinking, people started lot of things nowadays. Ultimately your body is affected. What is unnecessarily you are adding, body has to work to utilize, to eliminate or accumulate, result in lot of problems. Hypoglycemia affects the liver, fatty liver. Many youngsters now, because of this fancy drinking, fatty liver they are getting, and excessive fatty foods. Should not be taken on empty stomach, even if they are habituated, should not be taken on empty stomach. Especially on insulin or oral hypoglycemic medication they are taking, alcohol should not be consumed. Empty calories, you all know. Alcohol provides empty calories. Your fancy drinks, brands, you know, I don't want to name here. Companies we should not quote. Empty calories. Only sugar concentrate. with essence, what is that, some flavor, some color. You are just putting empty calories. Don't be fascinated. Take your own fruit juice, which has many things you all know, you are studying. At least who are studying these subjects should discourage others, and for yourself you should not. Combination of alcohol and sulfonylurea might cause intense flushing of face and palpitations. Exercise then. Okay, problems. How to overcome? Exercise and diabetes, you have a lot of impact. Lowers blood glucose levels, because glucose you are utilizing in the form of energy for your exercise. Increases the uptake of glucose by the muscle from blood, because you want to do a lot of exercise. Muscle requires energy. Glucose from the blood will be driven to the muscles. So blood sugar levels are controlled. Potentiates action of insulin and decreases insulin resistance. So action of insulin is improved by exercise. Our yoga practice nowadays, lot of importance is given. Assists with weight control, because you are exercising, excess fats are also utilized. Weight control will be achieved. Decreases stress, increases blood circulation, improves serum lipid levels like HDL. HDL, high density lipoprotein, good cholesterol, common people talk about, and that can be improved only by exercise. Or our vitamin B3, niacin, has a tendency to improve HDL. During glycation, LDL, VLD, all the lipoproteins are glycated. In that scenario, in diabetes condition, LDL, VLDL, when they are glycated, they are accumulated more, which are harmful. HDL, when glycated, is degraded, which we want, it is not available. So people should have above 45. Don't have any activity, any exercise, it will go below 30. Atherogenic index will increase, and coronary artery diseases will increase. Improves cardiovascular status. Exercise also, we have certain rules. Diabetes should exercise, the people having diabetes, 150 minutes in a week of moderate intensity. Moderate, not severe. Some news we heard in recent months, severe exercise also takes away life, oxygen supply, a lot of other complications. Something is good in optimal level. Beyond you do, anything will become problematic. Small carbohydrate snacks can be consumed in between the exercise to prevent hypoglycemia. Because when you are doing exercise, a lot of glucose is used. You may become hypoglycemic, which is very dangerous. Hyperglycemia is not a life threat. Slowly it affects the body. But hypo, because your nervous system does not receive glucose, you will collapse. Best time to exercise, 30 to 90 minutes after the meal, not immediately. Monitor blood glucose levels before, during, and after exercise. Don't exercise when hypoglycemic you are. Less than 70 milligrams your blood sugar, please do not entertain exercise. Don't exercise when hyper, when the blood sugar levels are beyond 250. So this is a glucometer what we use to know one drop. But capillary, you will get capillary sugar. And perfect profile you want to know, intravenous blood has to be taken. But at home level, those things are not feasible. So easily you can do. Even mobile, you can connect. The data will be stored 1 month before, what was it, now what it is. All that you can have in your palm. Complications of diabetes. Uncontrolled diabetes, almost all organs are affected. They are listed here. We go one by one quickly. Diabetes has routinely been described as a metabolic disorder. A number of times I told, all the metabolisms are affected. Characterized by hyperglycemia that develops as a consequence of defects in insulin secretion. Such a defect results in increased concentration of glucose in the blood, which in turn damage many of the systems, in particular the blood vessels and nerves. All these organs are affected. We can classify as acute complications and long-term complications. Acute complications, hypoglycemia, because you are on the drugs, without food, you are taking medicine, and dosage you are not much worried about what was told when you were hyper. When you are using, when sugar levels are under control, it will go to hypoglycemia. Just now I told you, the supply of glucose to the nervous system cannot be rapid, and it will lead to death. Death in diabetes happens because of hypo, not because of hyper. Ketoacidosis, already told you, blood pH decreases because ketone bodies are formed. Hyperglycemic, hyperosmotic, non-ketotic coma, also it may result. These are all acute, suddenly they happen. Hypoglycemia goes below 70. Anytime, day or night, it may happen. Often occurs before the meals. Without having the conscious, without having food, you are taking your medicine as routine. Then you will undergo this problem. Severe hypoglycemic episodes might need hospitalization. Suppose tremors and they are sweating, means like almost collapsing. Hospitalization is important. Or at home level, you can have some sugar, glucose immediately to save the life. Causes excess overdose, I already told you. Either insulin is more problematic under such conditions. You just take routine insulin injection. Tablet, at least you may take little time to make half and have. Unpunctual, inadequate, omitting a meal and taking medicine in a hurry. Now hurried life is leading to a lot of problems. War excretion, stress, unplanned exercise, already I told you. Ingestion of alcohol. Signs and symptoms, I told you already: sweating, hunger, confusion, headache, numbness, tongue and the tongue and lips, slurred speech, drowsiness, incoordination, not able to stand properly. Inability to concentrate. Management. 15 grams of fast-acting concentrated source of carbohydrate immediately you have to give. Better to give directly glucose or any sugar, which gets absorbed faster. 3 to 4 commercially prepared glucose tablets. Generally, who are on insulin, during travel, they are advised to carry these tablets in their pouch. Very essential. 6 to 7 pieces of hard candies, 2 to 3 tablespoons of sugar and honey, 8 ounces of skimmed milk. That will take a longer time. Milk, galactose, lactose, conversion, lactose to galactose, glucose, then absorption. It will be late. So better to have tablespoon sugar. Just take it, drink water. If you have glucose in the pouch, have glucose, 1 spoon, and drink water, then rush to hospital. Long-term complications. Microvascular connected with small blood vessels. Macrovascular complications connected with large blood vessels. We'll go to that quickly. Macrovascular complications: atherosclerosis, cardiovascular diseases, peripheral vascular diseases. Microvascular, tripathies we call it as diabetic retinopathy, diabetic nephropathy, diabetic neuropathy, sexual dysfunction, diabetic foot disease. Macrovascular, atherosclerosis, diabetes affects blood vessels, blood and heart. Diabetic patients are at greater risk of developing atherosclerosis. The susceptibility of diabetic patients to atherosclerosis is due to low HDL level. I already told you. We eat other things also. If HDL we maintain good, it will take care of entire episode. Most of the heart attack because of HDL being low. I already told you 45 above it should be, but some people it will be below 30. That is very risky. Lead to coronary heart diseases. Because HDL, you know, mobilizes excess fat, reverse cholesterol transport. I teach the advanced nutrition students. Reverse cholesterol transport from the tissues, from the blood. HDL takes excess cholesterol to the liver. Then what liver does? It will convert to bile acids. You are safe. You take good vitamin C. Cholesterol is converted to bile acids. Again, you are safe. Hyperlipidemia occurs in half of the diabetic patients. Already I told you hyperglycemia is associated with hyperlipidemia also. Diabetics have increased platelet adhesiveness response to aggregation. Platelet aggregation will be more, thereby plaque formation, thrombus, etc., leading to atherosclerosis, leading to coronary heart diseases. CAD, coronary artery disease, where blocks USANA bypass surgery is required. 20 to 60% of all diabetics tend to be obese or hypertensive and are likely to have clinically significant atherosclerosis. Coronary heart disease, already I told you. Type 2 diabetes, because adult onset, no, more chances. Approximately two-thirds of people with diabetes die of heart attack or stroke. Men with diabetes face a twofold increased risk for coronary heart disease, and women have 3 to 4-fold increased risk after menopause. Diabetics are more likely to develop myocardial infarction or congestive heart failure. Heart functioning becomes weak as uncontrolled diabetes proceeds for a longer period. Prevention, we have to maintain strict glycemic control, keeping minimum hypoglycemic episodes. Postprandial glucose level should also be kept under check. Lower LDL cholesterol level in the body, we have to take care. Oxidative stress oxidizes LDL. Oxidized LDL is more dangerous than ordinary LDL. Blood pressure should be maintained at an optimal level. 120/80 may not be there generally. For diabetic people, systolic will be more. 130/80 mmHg. Better to have BP measuring apparatus at home. Late night and all, suddenly you the person knows BP is rising, sugar is rising. So some home level remedy can be tried before going to the clinic. Microvascular, triopathies I told you, nephropathy. Diabetes is the leading cause of kidney failure, accounting for 44% of new cases. Nephropathy, renal disease, is one of the chronic vascular complications of diabetes, which tends to develop after several years of diabetes and results in progressive loss of kidney function, and they face an increased risk of death. How to know? Creatinine. Creatinine levels are under control. We have to maintain. Otherwise, if kidneys are not filtering properly, creatinine levels, urea levels will elevate. Filtration decreases. These are nitrogenous waste products. In the blood, their accumulation will be harmful. In diabetes, because of gluconeogenesis, urea creatinine protein degradation, creatinine urea levels elevate. So doubly, the effects are doubled. People with diabetes account for nearly half of new cases of end-stage renal disease. We'll skip because time, already told. Symptoms, kidney filtration will be affected, electrolyte balance is disturbed, blood pH alters, albumin is excreted. If you just take urine, heat it in your own house, albumin will be precipitated, albuminuria. So kidney function test like creatinine, urea, albumin have to be tested. Nephropathy management, salt restriction, control hypertension, vigorous treatment of urinary tract infections, avoidance of nephrotoxic substances, adjustment of medications as renal function changes, low sodium diet, low potassium diet. Retinopathy, eyes are affected, the vision is affected, retina, because of retina being affected, because of excess glucose in the blood. Blindness it may lead to. Affects almost all type 1 diabetes because from childhood they have, after 20 years. 60% of the type 2. This is normal eye retina. These are affected. Blood vessels leak fluid into retina. Vision will be affected. We are going to a little faster. Treatment, good metabolic control can delay the onset and progression of diabetic retinopathy. Every 6 months, those who have diabetes problem, eye testing has to be done. The expert ophthalmologist. Early detection and treatment of vision-threatening retinopathy can prevent or delay blindness if you are alert. This involves regular eye examination and timely intervention, control of hypertension, control of blood glucose, cessation of smoking, if at all that habit is there for man. Neuropathy. When you talk about eyes, cataract, galactose-induced cataract is there, diabetes-induced cataract is there. Because of excess glucose, it will be reduced to sorbitol. Sorbit by aldose reductase enzyme, and sorbitol is dehydrogenated to fructose. That will be slow. So sorbitol accumulates in the eyes, leads to opacity. Sorbitol cannot diffuse easily, and because of that opacity, cataract will develop. Many diabetic uncontrolled condition, slowly they develop cataract and they go for surgery. You must be hearing grandparents or relatives, somebody. Neuropathy, nerve functioning is impaired. Diabetic neuropathy refers to a group of diseases that affect all types of nerves, including peripheral, autonomic, and spinal nerves. Nerves are damaged due to hyperglycemia. Most common complication of diabetes. There are various types of neuropathies: sensory, motor, polyneuropathy, autonomic neuropathy. Paresthesias means numbness. Primarily lower extremities, feet, numb feeling will be there when you walk. Nerve damage can lead to sensory loss, damage to limbs, pain and numbness in extremities, already we covered. Decreased blood flow to nerves by damaging small blood vessels. Diabetic foot disease. This is, many people will have this problem. New chappal we wear, skin rupture happens. Suppose the person is diabetic, that will end with gangrene, removal of the foot. Very dangerous. So diabetic people I am talking about, even for us, any of you also, that skin rupture is there, better to apply antibiotic ointment. Otherwise it will lead to infection. High blood glucose level damages our nerves and blood vessels. Nerve damage from diabetes can cause numbness in our feet. As a result, we may not feel a cut, a blister. Numbness is there, so that feel won't be there, but effect will be there. 50% to 75% of lower extremity amputations are performed on people with diabetes. More than 50% of these amputations are thought to be preventable, provided patients are taught foot care. They have separate chapel to wear and care has to be taken. Practice them on a daily basis. Make them practice, okay? It is one of the most costly complications of diabetes, especially in communities with inadequate footwear. Weaker section, they cannot buy their costly chapel, shoes. They cannot buy, so they may not use it. There are a lot of NGOs coming forward to help, but that awareness again is lacking. That is a problem. It results from both vascular and neurological disease processes. Regular inspection and good care of the foot can prevent amputations by 45 to 85%. This is a small injury kind. It develops like this. And foot has to be removed, operated. Many cases, toes will be removed. Doesn't appear this blood glucose management is not done. It will, no cell. It will not leave anything. It will affect. I'm going to complete. Please bear with me. Pen drive we use. I have time up to 11. Crossed already. 2 more slides, please, please. I'm a file. Almost we are. Nutritional therapy, other speakers will be addressing. Pharmacological therapy means medication. No other go. You have a lot of medicines to control. When food fails, we trigger to medicines. Not avoiding food care, you will go for medicine. I'm not suggesting that way. You have the good food habits, good lifestyle management, you control. If doesn't work, then go for medication. But once medicines we are using, body gets addicted because they are fast acting. Sulfonylureas increase body's insulin production. Biguanides improve insulin sensitivity. Metformin can be used in patients who are diabetic, and dietary restrictions are not effective, but cannot be used in people with kidney disease, liver disease, and severe heart disease. Alternate medication will be suggested. Metformin is the simplest medicine, but even it will have problems. So what is wellness? Wellness is intellectual, occupational, physical, spiritual, and emotional wellness. That thereby, if you maintain all these things, we can be healthy. Divine presence makes it possible for me to handle every task, whose incessant love guides every fall and applauds my every success. Sai Ram, thank you. Any queries or questions or clarities? I'm behind the time. You are all our students, so anytime you can interact. This is for you education, so that you can guide your parents and your grandparents, your relatives. Information will help, because risk factors. This year theme for World Diabetes Day is risk factors, how to overcome. Okay?
Ma'am, we have a comment from Labani sir that it has a lot of scope for community health education and prevention of diabetes. The talk was good.
Thank you. Actually, I have done a lot of work on natural remedies for diseases. Some other context we use to know it. Another speaker we have for diet regulations and suggestions. Our director also is addressing certain points. So I'm limiting here. Thank you for your support. I thank the director, our faculty members, DFNS. I have grown in DFNS. What I am today, I was not that when I entered 1986 when MSc started. So Swami taught me how to do things. Everything I learned here. Indebted to SSSIHL forever. Sai Ram. Thank you.
Thank you, madam, for providing us with a comprehensive overview of diabetes. Now, I deem it my privilege to introduce our esteemed speaker for today's keynote address, Ms. Ira Rattan, madam. Ms. Ira Rattan is founder of Patya Prana, advocating for wholesome food that nourishes not just the body but also the soul. Currently, serving as the HOD nutritionist at Lord's Institute of Medical Sciences and Research, ma'am continues to be at the forefront of promoting health and wellness. With a rich academic background, our speaker has earned a diploma in nutrition and dietetics from VLCC and holds a certificate in clinical and sports nutrition. She is a passionate diabetes educator, having completed a comprehensive course from Vivo Healthcare Private Limited. Recognized for her outstanding contributions, ma'am has received Make in India Award as a vegan nutritionist by Bharat Nirman and the Clinical Food Meditation Award by Speaking Tree, an edition of Times of India publication. Today, she will enlighten us on captivating theme reversal and normoglycemic remission of type 2 diabetes mellitus through natural foods. Get ready to be inspired as ma'am shares her insights on how natural foods can help us transform and reverse type 2 diabetes mellitus. Without any further ado, please join me in welcoming our distinguished speaker, the expert in the field, the founder of Patya Prana and the HOD nutritionist at LIMS, Miss Ira Rattan, Madam.
Om Shri Sai Ram. Koti Koti pranams at the lotus feet of Bhagwan Shri Satya Sai Baba. Thank you so much for the opportunity, Shri Satya Sai Institute of Higher Learning, Anantapur, Vidya ma'am, and all the esteemed professors, ma'ams present here. Thank you so much for the opportunity. And thank you so much, Mrs. Anandula ma'am. That was simply wonderful and amazing and greatly insightful into the diabetes. So today we are going to be dealing with the topic of normoglycemic reversal and the normoglycemic remission of type 2 diabetes mellitus through natural food only. And it is absolutely a pleasure to be here on World Diabetes Day. If we see on the slide, it's not only the lowering of the sugar, that is reversal. But when we say together, we can stop diabetes by the American Diabetes Association, it basically is hinting towards the normoglycemic remission of type 2 diabetes mellitus. And because there are so many other factors which can lead to normoglycemic remission of diabetes, I would be dealing through natural food only. So type 2 diabetes, as we have just heard, is a complex, multifactorial metabolic disease provoked by the chronic overconsumption of unhealthy calories in those with sedentary lifestyle and genetic predisposition. But these are not the only factors. It does not really mean that if the person is overweight, only then he will have type 2 diabetes mellitus. However, it is preceded by a variable period of prediabetes, during which time the body tries to compensate for blood glucose level spikes coinciding with increasing insulin resistance and attenuation of insulin production, but which ultimately progresses if the diet, stress factors, and the other factors that we will see in our presentation is left unchecked, resulting in chronic state of elevated blood glucose level combined with increasingly sedentary lifestyles. So discussing the same, let me carry on to the second slide. I hope it is Winkles. International Diabetes Federation estimates that between 2007 and 2025, the number of diabetics in the world are expected to grow over 55% in the population aged between 20 to 79 and rise from 246 million to 318 million people. In this, they have not covered the increase in the juvenile or the neonatal diabetes that has started happening multifold, especially in countries like India, China, and others. In 1 out of 10 adults worldwide have diabetes. Over 90% have type 2 diabetes. Now, World Health Organization has a say in India that there's an estimated 77 million people above the age of 18 suffering from type 2 diabetes, and nearly 25 million are pre-diabetic. Therefore, type 2 diabetes mellitus is on the course to be the largest non-communicable pandemic in the human history. In 2016, The World Health Organization Global Report on Diabetes added, for the first time, this was the first acknowledgement that was there by the World Health Organization, that diabetes reversal can be achieved through a number of therapeutic combined approaches. Many studies, even the Lancet studies have now come around, that many studies, PubMed, indicate that the diabetes reversal and possibly even long-term remission is achievable by bypassing the conventional view. Now, we see the difference and the categories between the type 1 diabetes and type 2 diabetes. We know type 1 diabetes cannot be reversed. It can be reversed to the extent that is compatible with the body, blood test reports, and other parameters, but we can definitely lower the type 1 diabetes. But type 2 diabetes, we can not only cause reversal, but also normoglycemic remission, which is accredited. So where type 1 diabetes is usually found in neonatal or juvenile, in childhood and adolescence, or it can be at the time, it's not only the age, it is also somebody who has, let's say, they have bipolar disease, or they have their lithium medicine into it, and then they have the ADH hormone that has got affected. It will lead to pancreatitis and they might turn type 1 diabetes overnight. Or they might have an accident which involves the whole abdomen or the pancreas and can lead to type 1 diabetes. So the various types of type 1 diabetes, and Andallu ma'am has described everything so beautifully. Type 1 diabetes is unusual. Type 2 diabetes is extremely common. Ketosis is something that can usually happen with type 1 diabetes and is rare in type 2 diabetes. Insulin markers, C-peptide biomarkers of the beta cell reserves are important, seriously important for the type 1 diabetes and type 2 diabetes to be taken care of. And of course, pancreatic autoimmune. Type 1 diabetes and type 2 diabetes, ma'am has discussed in very big detail about its effect on its cardiovascular diseases, coronary heart diseases, diabetic neuropathy, diabetic nephropathy, food gangrene leading to amputation, diabetic retinopathy leading to blindness, and of course the kidney failures, and there's so much more, which are basic and the very needful requires even a skin infection. So there's a relationship. The more the sugar rises, the more the infection rise. The more the infection rise, the more the blood sugar rise, and it's difficult to control. And if there's an infection, which we can from the ESR, and then the inflammation, which is in the CRP report, in the blood test reports, we gather it can lead to foot gangrene, lead to amputation. It can destroy not only the patient and his life, but his family, his social life completely, and of course, his life. So thereby, since ma'am has already discussed, now we're going to discuss upon the ever-growing pandemic of type 2 diabetes mellitus. People who have prediabetes, they are obese, they have an increased BMI, they're 45 years or older and perhaps smoking and alcoholic, they're genetically inclined. So if their parents have it, their brothers, sisters have it, they tend to have the type 2 diabetes mellitus. Their inclination is much more stronger. They're not physically active for more than 150 hours a week. Or woman has had gestational diabetes. Then there's excessive stress with junk food, poor lifestyle, and lack of knowledge. Or perhaps drug-induced glucose alterations. We did see during the COVID-19, everybody was suddenly turning diabetic. Everybody was checking the CRP levels, and everybody was having so much of diabetes, and the diabetes was uncontrollable, leading to the side effects of coronary heart diseases, renal failures, and so much more. So infection, inflammation are one of the primary causes of a pre-diabetic or a diabetic patient, which increases tremendously. So diagnostic criteria which has been recommended, other parameters, they are the fasting plasma glucose and the postprandial. According to World Health Organization is supposed to be less than 110, American Diabetes Association less than 100, and World Health Organization pre-diabetes and diabetes levels. So here we'll be concentrating a little more on the normoglycemic levels. This is what we want to achieve on the normoglycemic remission. Remission parameters will be different from a normal normoglycemic patient, which we will see in the further slides. Now, can type 2 diabetes mellitus be really reversed? World Health Organization and Diabetes and United Kingdom now openly acknowledge that diabetes is metabolically reversible if lifestyle parameters and constant caution is followed. Now, I will share over here the 4 approaches that are detailed on the Diabetes United Kingdom website: low carbohydrate diets, very low carbohydrate diets, exercise, bariatric surgery. These are some of the factors that have been mentioned on the website. So there's a joint consensus statement on the definition of normoglycemic remission of type 2 diabetes from American Diabetes Association, Endocrine Society, the European Association for Study of Diabetes, and Diabetes United Kingdom. So basically, according to American Diabetes Association and the other consensus, the term remission is to be preferred to reversal and should be defined as a return of HbA1c. So it is like let's say if the train is going on the right side, suddenly it starts going on the left side. The medicines are reduced. The OHAs, they are oral hypoglycemic agents, the sulfonylureas, all of them, the strength of the medication is reduced, the combination of the medication is reduced, and ultimately the medication is reduced to a level which is highly good or compatible with the patient's lifestyle. And if the patient's lifestyle permits us, we should go in creed according to the American Diabetes Association and other forum that we have just heard, that it should be reversed and together we can stop diabetes. But it is important that the patient should be able to follow a proper lifestyle and should be constant, because we know hypoglycemia is not good. If it is like if he keeps on having the high OHAs or increased medication and starts lowering the diabetes or sugar through glucose levels through food, then what? It will result in hypoglycemia. Therefore, it has to be in accordance to the patient's lifestyle, and he should be agreeable to go into the remission and be free of medicines. So the term remission is to be referred as reversal and should be defined as a return of HbA1c to less than 6.5% and fasting blood glucose, plasma glucose to less than 126, either spontaneously or following an intervention that persists for at least 3 months in the absence of glucose lowering pharmacotherapy. These are the important criteria. So coming to this, the criteria is basically that states, according to the clinical studies, is the normoglycemic remission of criteria by ADA, Endocrine Society and Diabetes UK joint consensus statement on the definition of type 2 diabetes resistance is complete remission, no longer having pre-diabetes. HbA1c is less than 6.5% or HbA1c less than 6.5% calculated or estimated in the glucose monitoring values maintained without anti-diabetic drugs for at least 3 months. Testing of HbA1c, that is when you test the blood test or due to the oral glucose tolerance test or the HbA1c, is a document that should be performed just prior to the intervention and no sooner than 3 months after the initiation of intervention or withdrawal of any glucose lowering pharmacotherapy. So this is the criteria of the remission that can be easily followed if the patient allows us or if the patient jointly helps us to follow this criteria and be free of medications. This has to be annually done as a minimum. So we in remission also we have three stages. So then one, there is the less than 6 point HbA1c less than 6.5%, and then there is partial remission of type 2 diabetes mellitus criteria. Now, partial remission in quotes is when an individual with type 2 diabetes mellitus achieves an HbA1c of less than 6.5% and or fasting glucose of 100 to 125 megadeciliter and is off all diabetic medication for more than 1 year. For more than 1 year. So then it becomes the partial remission of type 2 diabetes. Then comes the complete remission of type 2 diabetes criteria. Now, a complete remission in quotes is when an individual with type 2 diabetes achieves HbA1c less than 5.6%, fasting glucose less than 100, and is off all diabetic medications for more than 1 year. So there's a difference between partial and a complete remission, but both of them have a time period of 1 year. And then comes finally the prolonged remission of type 2 diabetes mellitus criteria. Prolonged remission is when an individual, in quotes, an individual with type 2 diabetes mellitus achieves an HbA1c of less than 5.6% or fasting glucose less than 100 and is off all diabetic medication for 5 years and more. Is it possible? Absolutely. And it is happening completely. And lots of patients are getting benefited. The criteria, of course, again reiterating for the blood test, for HbA1c or oral glucose tolerance test, the testing of HbA1c to document a remission should be performed just prior to an intervention and no sooner than 3 months after initiation of the intervention or withdrawal of any glucose-lowering pharmacotherapy. This criteria is extremely important, and with that, it is also important that every annual year or 6 months or 3 months, the HbA1c should be done by the patient. The cautions should be maintained. And of course, the lowering of glucose pharmacotherapy or the lowering of the OHAs should be dealt in accordance with the blood test reports. The lifestyle, those we will be discussing more in detail. So what do we have? We have a reversal and then we have normoglycemic remission. Reversal is like when the person's HbA1c is 10 and after 3 months it comes down to, let's say, 7. Now this is reversal. This is reversal of blood sugar, blood glucose, or type 2 diabetes mellitus. Now this reversal can also occur with type 1 if all other factors and if his body parameters maintain. And there are clinical studies too on that. But this is only reversal, that is lowering of blood sugar, reduced HbA1c, lowers the risk of CHD, renal and other parameters that we see according to the blood test reports, and there's an improved clinical improvement also in the patient. But for the normoglycemic remission that we saw in the 3 stages, the parameters not only of the reversal, but then there's no medication for 3 months, test has to be done after 3 months, HbA1c has to be less than 6.5%. And as we discussed, there's this partial, prolonged and complete remission of diabetes, the 3 staggering stages that we saw in the previous slides. So what causes type 2 diabetes and remission? Now, in 2008, the twin cycle hypothesis postulated that there was vicious cycles of fat accumulation in the liver. This we are dealing with diabetes and obesities, which is very common in type 2 diabetes mellitus cases, but not all. So there are vicious cycles of fat accumulation in the liver and pancreas that lead to the development of type 2 diabetes over at least a decade. So this is what we see, the reversal of diabetes. Here we see that if not detected early, the type 2 diabetes, there's liver, the beta cell function, there's lowers down or there's a malfunction of that, there's a pancreas fat that is there are very low density lipoproteins, especially from, we get from the palm oil. Now palm oil has got lots and lots. The first thing that we come to know, okay, VLDL is increased. How many samosas did you have? Or how much Haldiram bhujia did you eat? So that is where the VLDL actually comes. LDL is basically from your ghee or ghar ka good oil that is there. So that has increased, or perhaps your triglycerides have increased. Basically, it is your lipid profile in the blood test report which gets rearranged with your liver function test. It can be a cause in the blood test report with the CRP level also. It can be a cause with the ESR level also, the infection, the inflammation caused by this VLDL, which is like one of the primary causes. So let's say palm oil is one of the primary causes of fatty liver, which can lead to liver cirrhosis. Now, this liver will not having, which is completely full of the fat around it. It'll malfunction. It will not be able to control the spikes and the lowering of the glucose in the blood. This is one of the very, very common causes. And when we go to the remission, then basically what do we have to eat the food, the diet to work on the liver. When we work on the liver, the diet that is important for the liver will also, now we can say that you need for antioxidative stress, you need a lot of antioxidants, and you need a lot of vitamin C over there. You need a good source of healthy protein over there, and MCTs, medium chain triglycerides, which can also be beneficial. We don't want keto diet because it's going to have more side effects in the blood test reports. So even the remission that we need to do, it has to be based upon a person's diabetic blood test reports condition. Now, to say if there was a patient, he had a fatty liver, his sugar was uncontrolled during COVID-19, and he went to the doctor. I'm from the clinical side myself, so all respects and regards to the doctor. But he went to the doctor and he said that, doctor said that if you reduce 10 kgs of weight, it is going to help you to lower your blood glucose levels. He went back, he went to a dietitian and he said that I want to reduce 10 kgs of weight. She said, okay, I will reduce 10 kgs of weight in a period of 3 months and you will find a great difference in your HbA1c level. The pact was signed. He lost 10 kgs of weight. His blood sugar reduced tremendously. But when he went to the doctor said that your kidney function test or the kidney function report, your creatinine, your uric acid, all the parameters, sodium, potassium, all of them are deranged. You need to now come for dialysis. So it is jumping from devil and the deep sea. It's jumping completely from the pan into the fire itself. So we have to be extremely careful that even if the remission that we are doing, it has to be based as per the blood test reports. It has to be taken into consideration that not increasing the protein to reduce your weight by increasing your BMI or increasing your basic metabolic rate or something. It's going to, cause the fat to break up, and then it will increase your triglycerides. Then the triglycerides need to be controlled, and then the parameters have to be taken to the blood test reports that none of the creatinine or uric acid can get malfunction. So importance of water really comes around that time. We'll be discussing more that in detail. But once there's a remission and the fatty liver and the liver starts functioning better, then the beta cell function also starts better because pancreatic fat gets reduced in the body. So this is one way that we can actually cause the reversal of diabetes. But this is not possible for all the patients because not every patient is going to be fat. Not every patient is going to be obese, but they still have diabetes and they're not type 1 diabetes also. We'll be discussing more that in the next slides. Now, the ways to achieve the remission of type 2 diabetes mellitus, this is as by the clinical studies. There's people who go for weight loss surgery, which is invasive. Now, somebody is weighing 150 kgs. They cannot exercise. Their parameters may be too low. But if the blood test reports permit us, and if they have other things possible, then we can slowly reduce their weight. But some people, they need to go for surgery. Or let's say they have a surgery and they have to go in for a bariatric surgery. Then of course, they also need to have a weight loss within 5 days if they have a surgery, because the liver is going to be picked up and kept on the side while they do the bariatric surgery on the stomach. So all things need to be dealt with their hormones level. Any person who's obese has leptin and ghrelin imbalance, and their hormonal levels need to be discussed, need to be helped, and they need to be really helped because they'll have a lot of depression and a lot of other factors, social stigma also included, and body figure, body shaming, all those things will be dealt with. Therefore, it is easier, much more easier to achieve the remission of type 2 diabetes mellitus through whole food plant-based diet, which is non-invasive. Low carb diet, non-invasive. Weight loss programs, which is again non-invasive. When we say whole food plant-based diet, there's a difference between vegan diet and a whole food plant-based diet. Vegan diet contains oil, whole food plant-based is without oil and has got the food and its whole. Now, low carb diet. Now, here I'd really like to discuss. Now, when we just say it's low carb diet, it's not just plain carbs. Even a piece of cake is a carb. Whereas other fibrous carbs is what we are looking at. We are looking at good, healthy carbs like millets. Again, even if we have to give millets to the patient, we have to check in account that they should not be having thyroid. That is important. Although they say that if you have fermented millets, or if the millets have been boiled, or if the millets have been soaked for a long time, they lose their thyroid causing effects. They lose their goitogenous effect. But why would we want to take a chance on a patient for that? The patient already has thyroid. So we can just shift from the millets to different kind of carbs which can help them to lower something what we really get amazingly, which I used to get from the shopping complex at Prasanthi Nilayam. I used to actually buy it, put it into the by air and take it home. Kerala rice, or what we call is the red rice. Red matta rice is what's amazing, got so much of fiber. It's not a millet. It's got amazing fiber. You can make chilas out of it. You can make so many things out of this. On the millets, I would like to say that although all millets are good for lowering your, because they have so much of high fiber, their carb content is same as wheat and rice. But the glycemic index of a millet is much, much lower. So goes for the glycemic load also there. But the red millet, red matta rice that we have, now that is something that we can have as a chila or something for the person whom we cannot give a goitogenous diet for thyroid. And if we are giving millets, they should be soaked or they should be sprouted so that they do not have goitogenous effect at all. That is something extremely important. Now, coming to this is dealing with the carbohydrates. Now coming to the remission of type 2 diabetes mellitus through natural food only. What we see over here is what is low carbohydrate diet. Low carbohydrate diet is like, used in various ways. As we already discussed that, their low carbohydrate is 20 to 50 grams per day based on 2000 kilocalories day. Low carbohydrate, less than 50, less than 130. Moderate, more than 50 or less than 130. Moderate carbohydrate, 130 to 230. High carbohydrate, more than 300, 230. Now, how much a person can be given, again, depends upon his blood test reports, the kind of carbohydrate that you're giving. Again, millets are really good. There's a fad about millets going on, but it should not be given to any patient who has a genetic history or is inclined towards thyroid. The patient is already living a very sedentary lifestyle, might be having subclinical thyroid. We would not want to introduce millets to them. Now, millets are great. They are anti-carcinogenic. They have great compounds and they are so cost effective. So when we are dealing with remission of diabetes, it has to be a solution fit. When we say it has to be solution fit, means it has to be cost effective. It should be in a localized region. It should be easily available and it should be part of the family routine. We cannot sustain on low carbohydrates or different kind of a carbohydrate or different kind of diets if our family situation is different. If we are not getting it very expensive. It is not sustainable. Getting a bariatric surgery is not possible for everybody. So if we need to have a solution fit for the normoglycemic remission of diet, then it has to be based as per the person's blood test reports, his family situation, and also we cannot give them low carbohydrate. I really prefer not to give low carbohydrates to my patients at all. It is the kind of carbohydrate, the timing of the carbohydrate that really matters. Now, let's say in fructose. Now, fructose, it's wonderful. I would give them like 3 to 4 colors of fruits, mostly citrus fruits for breakfast. One, it increases the sugar for 1 hour, and after 1.5 hours, you'll see that the sugar becomes really low because fructose follows a different pathway altogether. But of course, when we are giving fruits, we do not include carbohydrates and proteins or fat into it. Fat we can still increase. Supposing we are giving a mango smoothie. Now, if you have to give a mango smoothie, how to give this wonderful mango smoothie to a patient? Everybody loves mangoes. 250 grams of fructose follows a separate pathway. 250 grams is a mango, whole big Alfonso mango. But to reduce the sugar spike, we add a component of fat into it. And what could be a more wonderful fat than coconut milk or the medium chain triglycerides, which are beneficial to us? Because there are clinical studies which actually show that fat has a lower insulin resistance. It staggers the glucose spike. Because it staggers the spike, so we add the medium chain triglycerides. Same is the case with the protein. So we add, let's say, chia seeds. Chia seeds are great source of, or hemp seeds. But is it possible for everybody? No. We can introduce peanut milk, or we can add peanuts to the smoothie. It is so simple to make a peanut milk. So you just soak the peanuts without their covers, soak the peanuts, and in the morning, throw that water because it will contain phytates and other anti-nutritional factors, and blend it. Add water to it. You can even warm it. So you can have an excellent peanut milk or coconut milk and add it to this mango smoothie. Add it to the protein component. Peanuts are great components of protein also. This will have a sustained blood glucose lowering effect. It will stagger. The sugar spike will get staggered. And that's one of the wonderful ways that we can deal with increased carbohydrates and yet cause a lower sugar spike. Now, coming to the next, diving deep into finding the core issue of type 2 diabetes mellitus. Now, when we are dealing with the core issues of type 2 diabetes mellitus, it is just not about blood test reports. It's just not about diabetes. And it is just not about obesity. Obesity plus diabetes. But obesity in itself is a symptom. It is a symptom of underlying factors. And unless we work on the core issue of why that person is obese, nobody eats 5 to 6 kgs of food in one meal. It's not possible. They'll throw up. So there must be some reason that the person is reaching out to 6 chapatis or 7 chapatis in a meal, or 3 to 4 servings of protein or different food items. There would be a reason why the person is moving on towards cake, towards sugar food. There's casomorphin in milk, which works like a opium kind of, it has an opium kind of an effect. There are additives over there. There are preservatives over there, which can cause diabetes. So when the person is eating all those preservatives and non-organic food, no, it's not possible for everybody to have organic food. The solution fit has to be it should be cost effective. Those who can have organic food, it's great. But those who can go for kitchen gardens in their house, that would be absolutely like almost organic because they're not going to add pesticides. So these factors need to be told to the patients. They can grow certain food and vegetables in their own house if they cannot go for organic food. Coconut is something easily available in India. Peanut is something easily available in India. Why do we need to go for things like almond milk, cashew milk? Of course, it's okay if your cashew milk has got great amount of magnesium, which is going to help us lower the stress levels. Because magnesium is an antidepressant mineral according to the Indian Council of Medical Research. So of course, that way cashew is good. But then so are the fox nuts. Fox nuts are also high in magnesium. And a little bit of magnesium does help with management of the stress levels. So now we're going to discuss some of the core issues of diabetes, why diabetes actually happen or why obesity actually happens. So there's an increased carb. Now here which we are discussing about increased carb is basically at the time when the person is reaching out to junk food, cakes, 11 o'clock at night, 2 o'clock at night. Go to the refrigerator, have a piece of cake, can't sleep because you're getting the image of the cake in front. Or maybe perhaps somebody's market levels have dropped. Or maybe somebody's into a depression, a divorce, or maybe medically unwell. Or maybe there's a family situation in the house. Now, whenever carb is a comfort food, carb is absolutely a comfort food, so they reach out to increased carbs. And you'll be surprised when the patients come in the morning, they're having bread because there's no time. So they're having bread, and then they feel the comfort in the bread with the cheese of slice with the sauce on top, or a packet of chips, potato chips specifically. So those things, they increase carb, then there's disturbed or less sleep. Circadian rhythm matters. When there's a disturbed sleep, it does make a lot of difference because your stress levels in your body, tightening of the arteries and veins, which will increase the blood sugar or the blood glucose. Then there's mismanagement of macro and micronutrients. So suppose zinc. Now someone with a fatty liver, they would definitely benefited by zinc and selenium kind of a diet. More nutrients, micronutrients can be given to them with the zinc and selenium because it's going to metabolize the fat on the liver. So all these micro and macro managements also have to be dealt with the medication that has been given by the doctor. Less water consumption. This is one of the basic reasons. So there was this patient and all his parameters were very good and his diabetes was going higher and higher. But all his blood test reports were fine except for his uric acid. Uric acid was increased and that is what we triggered out to. The CRP, that is the inflammation, was fine. ESR, infection was fine. Lipid profile was absolutely fine. He was not overweight at all. He was not having diabetes. He was not obese, but his uric acid was high. So when we kind of figured it out, I said, how much water are you having? You don't have creatinine. You don't have increased protein levels in your body. Where is the problem? So we need to work on the core issue. The core issue was that he was having only 1 liter of water in the day. Therefore, sugar or glucose concentration in the arteries and veins increasing to a spike. All what we had to do is increase his water levels, lower his uric acid, which caused a substantial difference of almost 2 points in the HbA1c level in a period of 3 months. The water needs to be given as full of antioxidants. The water is such an important factor. Like we say, is 33% water, 33% diet, 33% exercise, 99% diabetes educator, we can take care of the patient. 1% that we're totally dependent is on person's willpower. The water consumption is so important. Now the water can be kept. Now we get, instead of going for Kangen water or, over expensive waters, again, it has to be a solution fit. Our matke ka pani, earthen pots. The water can be cleaned, boiled and put in the earthen pots. And then later on, this water can be transferred to glass bottles. In the glass bottles, if we're having 3 liters of water in a day or 2.5 liters of water in a day, the first, second, and third from 6 a.m. to 12 p.m. 12 noon from 1 liter, then from 12 noon to 4 p.m. second liter, and then 4 p.m. to 8 p.m. 2.5 or the third liter. These glass water bottles can have, someone can have lots of coriander, mint, that is the green smoothie. It will really help. Have lots of greens, whatever greens you get. Pan ka patta is also amazing. Add the greens to it. Add herbal greens to it. Prefer not to have tulsi into it because tulsi is known to have mercury. So have the other green leaves into it. Believe you me, even the simple hara dhania or the coriander is so beneficial. Have one bottle which is full of green. You can also cover it with a green paper, green glass paper, which can have the sunlight through going through the green paper or the glassy paper that we get. In the next bottle, you can add fruits or vegetables. So we can add aapka cucumber, lemon, ginger, all of these can be added. So it becomes more like a detox water, or I would say it becomes more of antioxidant water. In the third bottle, we can keep it functional for a water that has got certain amount of minerals. And we do that. Silver is extremely good. Copper is extremely good. We can add some copper coins, or we can have a copper bottle, or we can put some small pieces of a silver coin into it. They have their ions, they have their own nutritional factor into it, and they all can be kept in the sunlight and then had. This is not only going to improve the immunotherapy, or it's not only going to improve the immunity of a diabetic patient, but also help them to, we believe in homeostasis. The body has to come to its natural position as normoglycemic remission. So we have to fill that cell with all the macro and the micronutrients important for it, side by side, lowering the blood sugar. Then the homeostasis will come into place, and then the normoglycemic remission will come into place. Same goes for the fatty liver. This is, we discussed all the zinc, selenium, all the DASH, all the dietary approaches, all of them are good. But vitamin C, vitamin B, zinc and selenium, iron, and a good source of protein are great for fatty liver. So we stagger them. The first month, if we are giving a diet for the fatty liver, second month we deal with the management of macro and micronutrients, and third we deal with their stress levels. Because without stress, the whole they will not be actually be inclined to not have carbs. If we want to prevent them from having wrong source of carbs, then we have to manage their stress levels, their mood, cause a mindfulness, which will bring about changes in your blood test reports. Lack of awareness is one of the very core issues of the type 2 diabetes mellitus in not only urban but rural, type 1, type 2, tier 3 cities also. Glycemic index and glycemic load. The management of that is very important. There's not only glycemic food or a glycemic index of the food, but also how to cut your nails. What time to buy the shoes? They can't buy the shoes in the morning. If they buy the shoes in the morning, then because of gravity and everything, by evening, their feet will swell up. If they tie the laces very tight on the shoes, the feet will swell up, leading to diabetic foot, neuropathy, accumulation of high blood sugar levels, and numbness in the feet and the places. Can lead to gangrene. So what time they need to buy and what type of footwear also is important. All these should be covered in the lack of awareness. They cannot wear pointed heels. They need flat footers, and they should be covered from the front so that the feet do not get exposed, not only to anything that can fall on the foot, or they can hit against the wall, or they can get in kind of an infection. The nails should be cut straight The awareness is important. It should not be moved towards the sides, because even a tiny cut can increase the CRP and the ESR levels in the blood test reports, thereby increasing the blood glucose. So glucose lowering agents. Now, when we say glucose lowering agents, people come with I mean there are lots of other factors like आप नीम का पत्ता ले लो, आप करेला खा लो, so आपका sugar कम हो जाएगा. I totally believe them to be patchwork. They'll lower the sugar and then they'll increase the sugar. It is not food. If we're having neem leaves, it is good to have it, but then it is going to cause changes in your pharmacological medications also, on the OHAs also. If you're having one Karela or cinnamon water every morning and we're having Karela juice, the day we don't have this Karela juice, or we have Loki juice, or we have the cinnamon water, the day we don't have it, because your glucose OHAs, oral hypoglycemic agents, or the medications have been working according in tandem with the Karela juice and the cinnamon water and the neem leaves and everything and all, that day your sugar will rise. And that will cause a spike, a high and low, which is not favorable. So basic food should be in its place. We should not get dependent. This is something that we really realized with COVID-19. People were not able to go out for the morning walk. Therefore, they were not able to take the neem leaves. Fruits and vegetables were not there so much in the market. People were not going out to get them. They were sustained to having cereals in the house and pulses. That's why their sugar levels had started rising, even though they were doing great diets. So it has to be in accordance with the medication that the doctor has given, with the macro and the micronutrient management. Herbs are really good. Herbs are very much welcomed and they have a very important and a beneficial effect on our body, but we should not use them as patchwork. Wrong dietary and lifestyle habits, having increased smoking, drinking, having a lot of junk food, pizza, having a packet of having a packet of glucose biscuits every morning and a cup of tea can increase our. We also have dealt with the carbs, but you have not dealt with the hormones. Hormones also need to be dealt. We cannot take increased hormones from other animal meats. Milk, for example. Now, milk itself will contain the cow's hormones. It will contain insulin-like growth factor, bovine, casein. All these will be there when we drink a glass of cup of milk. Now, our own pancreas, they produce the insulin-like growth factor. We have our own IGI, we have our own insulin. But when our pancreas find, according to homeostasis, our pancreas find an increased amount or sudden increased amount of insulin-like growth factor, bovine, casein, and all these factors from a glass of milk, according to the homeostasis, our pancreas will reduce the supply of insulin immediately. But we are not having milk all through the day. We have it a period of a time and then we don't have. And then we don't have it even later, maybe have it in the evening. Suddenly there is a spike of insulin-like growth factor and the pancreas are like confused. Now what to do? There's already enough insulin-like growth factor. There's already insulin and so much of casein and all those things factors are already there. So let me go slow on producing insulin. And over a period of time, the insulin stops getting produced or gets less. And this is one of the primary cases of juvenile and neonatal diabetes, which of course there are clinical evidences which we'll be discussing just now. Then again, diving deep into the core issues or the environmental issues of type 2 diabetes mellitus and how to deal with them. Family situation, obesity, diabetes is only a symptom. The cause is somewhere else. Now the family situation is like that. If the woman is diabetic, Or if a man is diabetic, or if a mother-in-law is diabetic, father-in-law is diabetic, perhaps the other family members are not very conducive to his lifestyle. Perhaps there is no management of time. Maybe they have to go, they are doing multitasking, they have no time for themselves. They're always, taking care of the family and no time for themselves. They have so much of work to do. So their self love gets lowered. You need to love your body. It is the only property that God has given you for yourself. And till the time you are there, your body is there, the world exists. If your body is not there, you don't exist. None of the solar systems, nothing will exist. You will be your soul, and you will not have a body to enjoy on this earth. So we need to, if we are doing multitasking, we have to side by side serve others and take care of yourself also, so that you can serve others better. God has given you this body for a reason. We are not taking home food and all the time dependent on food outside. Or if the mother is totally dependent on going to the work, and she has to leave in the morning, and she's given the money to the child, okay, have it from the canteen in your school. So the child, who's already diabetic, who's juvenile diabetic, and is taking food from outside, his spikes of high and low sugar, and then the side effects of the sugar that we had seen with Anandula ma'am, they are really strong. There's an increased traveling for the sake of, people are going on the navy, they're in the ship, and sometimes they're just traveling because of their work. And it's like that, okay, I go to my mother-in-law's house, we'll go enjoy and come. When I come back, I'll reverse my diabetes. So that vacation period, I'll increase my diabetes, and when I come back home, I'll lower the diabetes. But this is natural, because you have to spend time with your parents also if they're living in a different city. You have to spend time with your mother who's living next door. And you have to help her and acknowledge that, it is good. But then that is a time when we resort to herbs. That is a time when we go for the cinnamon powder, or we go for cinnamon and all the other herbs, neem patti and all that, which helps us in these critical situations. We cannot say that, if my mother has cooked food and I will not eat it because it is high in sugar. If you have a little, have a basic quantity, and then side by side, according to your diabetes educator, according to your nutritionist, have your amount of herbs, cinnamon powder, your neem leaves, or whatever is conducive to your blood test reports. That is a critical time to have it, so that the sugar does not spike. Lack of depression. Sometimes people are so highly depressed. The person who has gangrene, he's feeling so guilty because he's giving so much of stress and tension to his family members. He's going to be in depression and sad. And then he has meat. Then he has non-veg, which has got arachidonic acid into it. Arachidonic acid is found only in non-vegetarian food, which will increase the stress levels. So if we see the stress levels, cortisol, and all those stress factors, adrenaline, fear and flight hormones, you see the face of the cow whose calf is in front, but the milk is being taken out for human consumption. The cow will be sad, the cow will be depressed. So what will it give? It will give all these hormones will be released in that glass of milk, which will be given to a child. Or it will convert into a piece of cheese, which will put it on a slice of bread and have. Increasing the depression state. And the more the depression, the more harm you're doing to your body. Not only will it be depressed, you'll reach out for junk food. You'll reach out for carbs. They're not only the hormones that you have got from the cow's milk of increased insulin like growth factor and bovine, but also estrogen. But also you are increasing that by drinking the same, which will lead to a multifold effect in your HbA1c levels. Of course, there are clinical reasons also. Clinical reasons are something like a person who's in depression and is taking bipolar medication. So naturally, bipolar medication will have lithium, and this lithium will affect the ADH hormone, and this will lead to diabetes. It may be pre-diabetes, diabetes, and then type 2, and then it will ultimately lead to type 1 diabetes over the time, because we are not causing a reversal, we are not causing a remission. We are just having the OHAs and sulfonylureas, which in the long run is going to affect the heart and is going to affect the kidney. They're the byproducts. Just like medication, just like medicines, so is the food. Food harm, food heals. Now this lady, she was a dentist, and the dentist had cancer. When she had cancer, she was in the hospital. She was under those medications and going through the radiation and treatment and all those things. And her sodium potassium levels shifted. When her sodium potassium levels shifted, she reached the ICU, because then she was put on potassium binders, and sodium salt was given in the form of that Bicasol capsule was opened, filled up with the salt, and then the salt was given to her so that the potassium could be lowered. Can it be achieved through food? Yes. When she had to go for the second time, she is a dentist herself. When she had to go for the second time, she gave a call and she says, I don't want to go to the hospital again. I'm already terrified with my cancer treatment. And when I go over there, they are going to put me on potassium binders. Now, is it achievable through food? Yes, easily. Practically every food has got potassium, high amounts of potassium, be it rice, be it millet, be it wheat, be it everything. Fruits, vegetables, all have got increased potassium. 4 days. 4 days, her potassium levels from 5.8 came down to 3.4. 3.5 is supposed to be the lower benchmark. It came down to 3.4 so that we could create a buffer also. Was it possible through food? Food harm, food heals. Now, what fructose, what fruits would be beneficial as antioxidants to the cancer patient or to a diabetic patient, which is going to improve the nitric oxide level so that the stickiness in the arteries opens and the glucose levels fall down. Same food can increase the potassium levels. And most of the diabetic patients, they reach the ICU not because of the diabetes, but because of electrolyte imbalance. 4 days, it's all what it took to lower her potassium levels without potassium binders. Lauki, tinda, tori, onion. These are the only 4 things which have got low potassium. So a diet was made in high protein. High protein was given to her definitely. High protein was given so that we can maintain it and not let it fall down completely. High protein diet was given to her like tofu, which is also high in potassium. But that was the only source of potassium that we took. The rest, all fruits and vegetables were minus because she's a cancer patient. She needs, and diabetic patient, she needs her protein levels. So we gave her tofu, and then we gave her lauki ka kofta, kofta. Then we give her lauki ki kheer, again based in completely in other milk, not in the dairy milk at all. And we gave all these vegetables, and we made lauki ka chila also for her. Simple, just mix it into the lauki, grind it, and put it on the tawa and have it. Fat she can have. Fat is not a problem. So we can give her peanut butter. So we can, how peanut butter is made? You just roast the peanuts, put it into the blender, put it through the mixie. First it will crush and then it will spread into butter. It is just this, so simple. Or crushed peanuts can be added if we are making kofta. Simple lauki ka kofta in a steam idli. Like we steam the idli, so we steam the lauki ka kofta. And then we put it onto the tawa or into the air fryer or into anything comfortable and brush it. If we add peanuts into it, or if we add MCT like coconut into it, it will give its own glaze of oil. We don't have to really put the or smother the oil on it. So that how we contributed her diet plan, and within 4 days we got her potassium down and kept up high with the protein levels also. So basically, it is a macro and a management of the through the blood test reports. That is important. Again, it goes to 33% diet, 33% water, 33% exercise. 1% we have totally depend upon is on patient's willpower. That is something extremely important. Because if the patient does not have the willpower and we try to lower the sugar and the medicines OHAs are still high, then it can result into hypoglycemia. So the patient has to be completely aligned with the diet that they're having, and we have to increase their mindfulness. We have to cause that mindfulness by talking to them, discussing things with them, and helping them. So we need to work on the core issues. Dietary changes bases the medical prescription of doctor. Now, if a doctor is given a simple metformin, now it's not even 50 by 500 or something, 50 by 250. It is simple metformin, absolutely. Then why are we going to give them a very strong diet plan? Then why would we want them to have patchwork kind of herbs and things like that? Then we give them normal. But if the person has a HbA1c of 10, now to discuss this factor of my father only. So during COVID, his HbA1c touched 10, 10.4. I was in the house, so I was able to take care of the dietary changes. That is someone very important. So we have to include the family into it. 1% of the family should be aware of what the parent or the brother or the sister is going through and how their diet should be managed, how the stress levels should be managed. So it is just not about the patient, it is about the family, it is about the dining table, it is about meal planning, which needs to be given accordingly. So because I was there and I stayed with my dad, within 4 months, we got the HbA1c down to level 6. It was so simple. I just stopped the milk completely. No good. He was having a lot of jaggery because he was told not to have sugar, so he started having a lot of jaggery. Stop the jaggery. Increase the protein. Increase the right kind of MCT, coconut, grated coconut salad, peanuts. And his HbA1c came down to 6. Today, he's on Normoglycemic remission of diabetes mellitus because his HbA1c is now 5.6. Completely down, no medications, nothing. It's been a period of 2 years now. Maintenance is very important. Discussion to cause behavioral changes. Time management is extremely. Some people, they're not able to follow the time at all. Where we tell them, you have after every 2 hours. Sometimes we go into intermittent fasting also. But then again, the intermittent fasting has to be done when the circadian rhythm and everything is in its place by the diabetics who are not highly diabetic. Their HbA1c is manageable. It is like 7. So we start them with rejuvenation, regeneration of the cells through intermittent fasting. That is very, very beneficial. Sugar levels come down, the cells get revived, the body starts looking after itself, and the changes are very visible clinically also. Energy levels increase. But if a patient has difficulty in managing the time, not able to eat on time, it's so small, you can just keep some nuts and seeds. If your blood test reports permit, then you can just keep them in your pocket. Even if there's a meeting, you can excuse yourself for 10 minutes, go out, have some nuts and seeds or have consumption is also wrong. We cannot go in for high amounts of uric acid levels just because we suddenly started having apple cider vinegar. Our lemon is very good. It is cost effective and it is also solution fit according to our India. And too much of ACVs or too much of apple cider vinegars, they're going to degenerate the bones. Just the way a diabetes would do. Sleeping causes habits, circadian rhythm. That's the time when the melatonin actually functions out in the darkness. Blue color is conducive. It helps. Blue color is the only light that should be on. No other light should be on at night. Preferably sleep in darkness. It helps to rejuvenate and regenerate the cell. So we work on these core issues. Now, if you're dealing with type 2 normoglycemic remission of diabetes, but if the person does not have circadian rhythm, does not follow circadian rhythm, or does not sleep well at night, he will not only be not able to lose weight, if he does not have a weight issue, his stress levels, his melatonin will not be produced. As a result, his sugar might get lowered, but it will be difficult to cause normoglycemic remission of diabetes. Self-love, mindfulness, management of what you're eating, how to make your food plate into a medicine. We have to go for a la carte, we have to go for marriage functions, we have to have a buffet. Now, when we're having over there, we need to know how much protein, how much salad to be had. Now, when we're dealing with salad, I'll share a very beneficial salad basis the blood test report of a person. So, if a salad can have a component of cucumber, coriander, mint, peanuts, amla, as well as grated coconuts. It is a complete highly antioxidant protein from peanuts and lots of MCTs or the healthy fat from the coconut. Now, this kind of a salad, if the person has two big bowls, basis his blood test reports and other parameters of the electrolyte imbalance, or basis all that, if he's able to have this kind, or of his dental caries, if he's able to have this kind of a salad before eating the food. So if we have the intestines, our digestive system, first the antioxidants goes, MCT goes, good source of protein goes, vitamin C goes, and gets absorbed. Then you start having the protein, carbohydrates, fats, proper, normal meal. So when we have the salad first, when we are mindful of having the salad first, this kind of a salad which has got MCT in it, which has got protein in it, high source of protein, peanuts are good source of protein, coconut is also source of protein, and also all your antioxidants over there, vitamin C in its place. That is what is actually going to lower the blood sugar levels, because it's going to have a sustained blood glucose release system caused in the body, SBGR system. So this is the system that we actually do. We do the system, yeah. So then there's intermittent fasting, which we discussed. It should be done primarily by diabetics who are not highly diabetic, but should be at the time of, I'm sorry, getting a call. Saira ma'am? Yes, ma'am. Yes, ma'am. I'll just rest. So this will actually help in that. I'm rushing with the cause of time. So going to the next slide. So this is one case study that I would like to deal with. So we know that it has foot ulcer infections and everything. Now this patient was referred. He had HbA1c of only 7.8 on 3rd December 2018. 2 toes were amputated, severe gangrene. And we know when the gangrene happens, inflammation happens, the sugar rises as well as the infection rises, and 2 toes got amputated. The old gentleman from Gurgaon, and with his permission, I'm sharing, so they've given a testimonial. So he was going from old Gurgaon to Gangaram Hospital, which is almost 2.5 hours drive. And his HbA1 was 7.8. What had happened? He was going to the other room, and he picked up his chappal and his slippers, and his nails were a little long, which went against the wall. He developed a little bit of pain over there, which turned into gangrene, because it was 3rd December, it was winters. He didn't realize that the pain that was increasing actually turned into gangrene. And we're happy to share that on 27th February, he actually gave a call. Beta ji, आज मैं गंगाराम की सीढ़ियां चढ़ गया और मेरे को पता भी नहीं चला. And he said, who's this? Because I had never connected with the patient. I was connecting to their 9th class girl, to 9th class granddaughter in the house, telling them this is the food, this is what it needs to be done. Your 9th class girl was managing everything, what not to eat in plastic, not to have milk, not to have the extra hormones, not to have toxicity, have to have a proper amount of water, de-stress themselves. All those things were taken care of. Now, today, he's enjoying himself completely. He's walking, he's not dependent upon anybody. But does this patient is this patient taking any medicine? Very little. Metformin, just 50 mg as a precautionary measure because he was a diabetic patient. So although he is on the reversal and is almost on a non-remission, which we can do, but still it is not safe to do it because anytime he can go into hypoglycemia. So that mindfulness is important. The mindfulness of a patient is important. How much level are we willing to go? If the patient is not able to follow the diet plan or the lifestyle completely, then we will not let them go totally into normoglycemic. We'll increase their blood sugar levels. It's like a gas burner. Then you increase it. You have to eat sweets. And we create a buffer also. Okay, 3 days you have not had, you'll find a sugar, you have a gulab jamun and your sugar is still lower. So we have to create that kind of a situation which is very easily manageable. The second case study, I'm doing it of Mr. Rakesh Kapoorji, again with his permission, and his HbA1c was 10.7 and he was on insulin 8 units. No genetic history. Both the cases, no genetic history of diabetes mellitus. And we reached to 6.2 HbA1c. Metformin 500 in 8 days. So, sorry, it came down to metformin 500 in 8 days. Simply getting down because he was having increased amount of carbohydrates and a lot of stress levels. Again, it is 33% diet, 33% water, 33% exercise. 1% is the willpower of that person. So he had fatty liver, he reduced 18 kgs of weight, a typical case of type 2 diabetes mellitus, and he was able to be free of, clear the reversal and remission of normoglycemic remission of diabetes mellitus criteria by ICMR ADA. Until date, he is not on medication. It's been almost in 2021, this is 2022, and this is now 2023, almost coming to an end. He's not on any medication at all. So we have to depend on the patient to patient. Coming to clinical perspectives, plant-based diets and diabetes, the effect of animal protein, that is the arachidonic acid that we receive from there, and the stress levels and the hormones that we receive, and then there are meta-analysis of randomized controlled trials. Basically, this is for the plant-based diet, whole food plant-based diet. Low-fat vegan food. So when there's low-fat, vegan food primarily means a low-fat vegan food and a conventional diabetes diet in the treatment of type 2 diabetes. A randomized, controlled, 74-week clinical trial. So this was done. And again, vegan food means a lot of oil. We do not take the oil. We take low-fat vegan food. Best is to go for whole food plant-based diet, which has got coconut as medium triglycerides. So when we have the poha, when we have the red rice poha, we can say, or we have this now, suji is very high in sugar, so we don't go for the upma, but we go for the red rice poha. So if we put a layer of oil, that is the coconut oil into it, or let's say grated coconut into it, it forms like a covering on the cereal. And it's a covering on the cereal. So when the insulin comes, so this staggered effect of glucose release. It does not cause a spike. Also, you have peanuts and lemon juice put into it. That is something extremely important. Addictive foods like casein, aapka milk and milk products, they're extremely addictive foods and have got hormones which are not insulin, like growth factor, bovine, and casein, which have got addictiveness into them. Even the sugar is carbohydrate is completely an addictive food, or they're the comfort foods that we have. So then increased amount of infection. So one spoon of pus is there in every glass of milk. In every glass of milk. So ideally, we have to take milk and you add water to the milk and have, or best is to go in for plant-based milks. So these are the some things that I really wanted to discuss and share, and I'm really grateful for this opportunity. Thank you so much, ma'am, Sairam, and thank you. How do I close?
Thank you, ma'am. Now we'll take up some questions that are asked in the YouTube chat box.
Sairam, ma'am.
Any questions? Anybody? Any questions here? Yeah.
Saira ma'am. Saira ma'am.
Sairam, thank you so much.
Saira ma'am, ma'am, this is Shreya. Ma'am, first of all, thank you so much for this wonderful knowledge that ma'am has given us. Ma'am, I have a question, ma'am. Ma'am, generally, in what ma'am had told, that the diabetic diets usually contain a protein component in it. But if the diabetic patient is also diagnosed with gout, then how do we modify the diet? Like the amount of protein or any modifications, what ma'am suggests?
Absolutely. So that is the time we give them, if, depending upon their kidney function test report, and we'll be able to analyze what is the effect or the increase of the amount of gout problem that the person would be having. So we reduce it down to 0.5 grams per kg body weight. Protein is important, but we reduce it down, and then we also add herbs to it to manage it. Now that is the kind of a patient you cannot give too much of protein. If we give too much of protein to any diabetic patient, it is going to increase the creatinine uric acid levels, which will lead to gout. So we come down to 0.5 grams per kg body weight, and then slowly increase as in how the sugar levels come down. Also, if the gout is there, then the infection is there, and if the infection is there, the sugar will rise. So to manage the gout becomes more important rather than managing the diabetes. When we manage the gout and remove the inflammation over there by increasing the antioxidants, by increasing the water content, by having that water, how to prepare the prepared water that I shared with you, by increasing the antioxidants and by lowering the uric acid levels, by removing the amla, lemon juice, all those things which increase the uric acid, by lowering that effect of the uric acid, by management of gout, will be able to manage the diabetes better. Because they both will have an inflammation. The more inflamed the gout is, the more high the sugar will rise. The more high sugar will rise, the more inflamed the gout will become. So we'll have to manage them in totality and reduce the increased protein. So we have to, rather than going from 0.8 or 1 gram of kg per body weight, we'll come down to 0.5 grams.
Thank you, ma'am.
Saira madam, just one doubt I have. Madam, can we replace coconut milk with, cow milk with coconut milk, madam?
Sorry, ma'am, cow milk?
No, actual packet milk, not at present we're taking only packet milk because we used to, but now only packet milk, madam.
Yes, ma'am. So when we take a packet milk, which comes from various milks, various milks of different cows, homogenized and pasteurized, but the cow milk in itself will have the hormones of different cows in totality. And moreover, that packeted milk will still contain, even if it is pasteurized or homogenized, the allowance by the government of having 7,000 pus cells will still be there. More than that, even if it is in a packeted, it is a cow's milk, will have insulin-like growth factor. It will have bovine, it will have casein, which are determinant to diabetes, which are determinant to sugar, because it will affect the pancreas, not the blood glucose. If you see the glycemic index of curd, or if you see the glycemic index of milk, it's very low. So as per the clinical thing, that it is very low. But what we are discussing, what will happen are the hormones that are there in the cow's milk. Now, camel milk, the hormones are very different. In the camel milk, the IGI levels and all are very less as compared to a cow. The estrogenic effect of a cow's milk will be very less as compared to a camel milk. But the cow's milk will definitely have its own hormones and will work on the destroy the homeostasis with the pancreas in our human body. Ragi is one of the millets. I forgot to mention, ragi is one millet, is the only millet which will increase sugar. There are not much clinical studies or evidences into it, but on the experimental front, if you just stop the ragi for some days, you will find that the sugar levels of the day, of the random, and not only of the random, of the fasting, of the postprandial, will suddenly fall down. And one point that I'd missed, thank you so much for bringing this, and ma'am, and also the milk of a cow, because of its hormones, not because of its glycemic index or the glycemic load, because of its hormones, is detrimental to the pancreatic health of our bodies.
Thank you, madam.
Sairam.
Saira, madam. Madam, just one clarification we need. For juvenile diabetic, should we recommend cow's milk or dairy milk, or should we go for alternatives?
Ma'am, the juvenile diabetes is really on even neonatal diabetes. It's really highly, it's like it's going in spikes. See, the first time when the child drinks a milk, he automatically on his own, he rejects the milk. And that's the reason why this Complan and Boost and Horlicks are there, because they take care of the sense, they take care of the taste, and they take care of the smell of the milk. So naturally, our bodies reject to it. But what would be ideal if you know someone who is diabetic? It will be my handphone little request: stop the milk for at least 1 month. Experiential learning is the best. Just stop the milk for 1 month. You will find a lot of change. Even if they have skin infections due to diabetes, the dermatological changes will be present so much. And if they are able to leave it for 3 months, you will find, even if nothing else is done, gluten is another factor. That is why we switch to the millets. But even if gluten is there, and if you just stop the cow's milk, there will be good amount of difference. Experiential learning is the best learning in case of clinical studies and all those things. Even Lancet study has now come around with milk as becoming a positive factor in juvenile diabetes and adults. Cow's milk. Yes.
Okay, madam. Thank you.
Excited.
This is Professor Srividya here. Thank you, Mrs. Ira Rattan ma'am. Actually, I've touched upon so many burning issues, I could say, with respect to diet and diabetes. Maybe we should have another session, interactive session, to sort out many more doubts and queries that may be coming up. But due to lack of time, we'll be just winding up right now so that we can proceed with the remaining program. Thank you so much again.
Thank
Over
you so
to
much. I'm
Monica.
totally grateful, ma'am. Totally grateful for the opportunity. Sairam.
Thank you, madam, for your enriching talk and enriching our understanding on reversal and normoglycemic remission of type 2 diabetes mellitus through natural foods in a simpler and effective way. With your expertise, we have learned a lot, and we are very much thankful to you for sharing your valuable knowledge today through this platform. Thank you so much, madam.
Sairam, ma'am.
Now, it's my distinct honor to introduce our director, my research supervisor, and esteemed speaker for today's session, Professor N. Srividya Madam. Ma'am is an illustrious alumna of Sri Satyasai Institute of Higher Learning, currently serving as Director of Anantapur campus. Having headed the Department of Food Science and Nutrition from August 2017 to May 2022, ma'am is a recipient of 2 gold medals for distinction in BSc and MSc Food Science and Nutrition from Sri Sathya Sai Institute of Higher Learning. Ma'am's academic excellence extends to being a UGC NET Research Fellowship qualifier. Ma'am has garnered recognition through awards for scientific presentations and received the Science Father Best Research Award and Sai Krishna Award for Excellence in Research from Sri Sathya Sai Institute of Higher Learning. Professor N. Srividya has an impressive track record with 6 PhD research scholars, 39 MSc projects. Ma'am is a reviewer and editorial board member for more than 15 scientific journals. Ma'am has over 50 publications in international peer-reviewed journals and has designed content for more than 20 courses. Ma'am has received research funding through different national agencies such as UGC and ICMR. Ma'am's contributions to academia and research have left an indelible mark on the field of nutrition and research with a Hirsch index of 12 and more than 900 citations. For her work in areas of food metabolomics, public health nutrition, post-harvest technology, food microbiology, functional food product development, and food chemistry. Today, ma'am will enlighten us on the captivating topic, time-restricted eating and metabolic syndrome. Without further delay, let us welcome ma'am to grace us with her expertise. Welcome, ma'am.
Shri Sai Ram. My reverential pranams at the lotus feet of our founder chancellor, Bhagwan Sri Sathya Sai Baba. Respected elders, dear colleagues, my dear research scholars, students and guests of this symposium. Welcome to you all once again. Now we had a very scintillating talk, I should say, in the morning by Professor Andallu, my own teacher, and also by Mrs. Ira Rattan Madam, who really came up to give this talk in a very, very short time. I really thank both of them. There were a lot of points which our previous speaker had pointed out. One being the importance of circadian rhythm. Now, circadian rhythm, when we talk about, we generally refer to the sleeping cycle. Like when do we go to sleep and when do we wake up? But the other side of the circadian rhythm is the waking part. When we are awake and what we are doing. So right now we have been talking about what are the different dietary approaches which we can have, what are the other interventions we can have to handle a metabolic disease like diabetes. So here I'm just going to have a very brief presentation about one of the recent strategies, I would say, of handling various metabolic diseases, and I'm just going to start with the cluster of these metabolic diseases which is referred to as metabolic syndrome. So what is this metabolic syndrome? It is a group of conditions that together raise your risk of coronary heart diseases, diabetes, stroke, and other serious health problems. And in fact, it is also called as insulin resistant syndrome because as you all know, insulin resistance is actually the culprit. Okay, we generally say diabetes means increased sugar, but it's not the sugar which is the culprit, but the insulin resistance which is the culprit. And it is reported that in places like America, metabolic syndrome occurs in more than approximately 30% of the adults. That means every 1 in 3 adults is supposed to be suffering from metabolic syndrome. So how do we know that this metabolic syndrome is there in a person? So So there is a set of conditions. If 3 or more of the conditions are present in a person, then it is considered that the person is suffering from metabolic syndrome, because it's a cluster of conditions. So first one is a large waistline, or more specifically the abdominal obesity. Okay, so this is very big risk factor. So obesity becomes an underlying principle, and there is a lot of link between insulin resistance and obesity. Then if a person is having high blood pressure, high blood sugar levels, high blood triglycerides, and as well as HDL cholesterol, if HDL cholesterol is lower, it should be minimum 40, especially for 40 milligram per DL in the case of women, that is the desirable. Now, among these metabolic syndrome cluster, we have a very great interest in diabetes, and today being World Diabetes Day, I thought I will give some emphasis to that. Now, diabetes, as you all know, is a metabolic disease characterized by elevated blood glucose levels. We commonly call it as sugar, though that is not the right term, which leads to serious damage, as you had already heard from Madam, that a lot of risk factors are there and a lot of complications, which reaches out to various organs of the body. And now we have more and more evidence that it not only affects these, but more, like our mental health, our taste, perception, and so on. So I'm not going to the statistics with the lack of time. We all know that we are very rich people with respect to diabetes, and we're all very, very sweet. Now, so we want to now look at something more than what we have been talking till now. So I thought we will talk about what is known as time restricted eating, TRE. So I just first would like to play a very small snippet from Dr. Sachidananda Panda, who is one of the pioneer in this TRE research, scientific
We
research.
should be eating for no more than 12 hours in a day, because we need that 5 hours of digestion after the last meal, and then 7 to 8 hours of repair and rejuvenation to be ready for the next day.
So that about a couple of years back, we started looking at it as to what is this role of time restricted eating. And when a book was coming up titled Metabolic Syndrome, my co-author here, Professor Dr. Sanjeevi, who is also attending the conference with us through the GMeet, he proposed we write a chapter for this book. And so we selected the topic of dietary interventions to combat obesity in metabolic syndrome and the role of time restricted eating. So this has now very recently came into the print. It's in the digital format, soon coming to the printing, an Elsevier publication. So then I dwelt deep into it along with my Dr. Ashrita as to what this is. So we looked at that time restricted eating is a form of intermittent fasting, which has emerged as a novel strategy to reduce body weight, as well as which can help to control the glycemic response. And it involves eating within a certain window of time, just like your intermittent fasting. But here the window span is not very strict. It is usually 8 to 10 hours. It is, gives a wider range of eating period. And the other accompanies water fasting or non-calorie beverages for remaining hours of the day. During their eating window, participants are allowed to eat ad libitum and do not need to count calories. There's no calorie restriction involved in TRE. That is one of the major difference between IF, intermittent fasting, and TRE approaches. So when we looked at the things, so this is how we summarized in diagrammatically in that chapter. We found that there are 3 types of TRE when we looked at the literature and various studies. One is the early TRE, where you could start your eating window from 8 o'clock in the morning and then try to finish it by 6 hours. 6 o'clock in the evening, or you can start at 10, complete it at 8, or some people who like to skip breakfast and then have it from lunch. They would like to prefer from eating from lunch. So, and because they may be working late and then coming back home late, so they cannot have, dinner before 6 or 8. So then they can start late and then end by 8 o'clock or a little later into the night, maybe even by 10. So this is how we found that there are these things compared to the IF, which is very more stricter eating window is there and with calorie restriction.
So when we looked at many studies, as you can see here, this first one is again by Dr. Panda's group, time-restricted eating for the prevention and management of metabolic diseases, which came in very recently in endocrine reviews in 2022. So like this, you can see that there are many other papers which have come in good reputed peer-reviewed journals. For example, time-restricted eating for the prevention of type 2 diabetes. So you can have there here. So like this, many have already come up in the last 2-3 years itself. So it is a topic which is picking up a lot of scientific and research field. Also, people are looking at it and trying to work on it. So when we looked at all of these, we just tried to understand what is the summary of the, our analysis. We found that time-restricted eating seems to be effective both in the short as well as long-term basis, and in all the 3 types, whether you are doing early or the normal TRE or the delayed TRE. And the main outcomes is, which we found in with respect to obesity management, is that it had weight reduction as well as weight maintenance. See, that is another very, many of the weight loss strategies, you do reduce weight, but then weight maintenance is a challenge, which this was able to help. And fat mass reduction, it is not just a weight, but the fat mass reduction and reduction of visceral fat, that is more key to any of the strategy, or if you want it to be successful, the waist circumference visceral fat. So TRE also was found to suppress appetite. What is the mechanism? We need to understand the mechanism, what it is doing, how it is doing. So we found that based on the various studies, that it is suppressing appetite and hunger by reducing ghrelin. These are the hormones, satiety hormones, etc. The hunger inducing hormone, and could even improve the gut microbiome composition. So we just have a brief discussion or a description of this effect.
Has anyone ever looked at how time-restricted eating affects satiety hormones like leptin or ghrelin, which would be the one that makes you hungry?
Yeah, so we haven't looked at that in humans, but in mice, what we see is all of these hormone levels, they come back to more homeostatic range. That means they don't go too high and they also don't go too low. So that was kind of surprising, because we thought that the hunger level will go up and the hunger hormones might go through the roof. But somehow after a few days, the body adjusts to it, and then it keeps them in a homeostatic range. And also humans who do it, we do see that after 2 to 3 weeks, the hunger at bedtime is pretty low. They don't feel hungry. They might feel actually lighter and ready to sleep. So then they realize how it feels like to go to bed with a lighter stomach than with a heavier stomach.
And then once you actually, if you break that time-restricted, eating or feeding window, I've noticed, at least in myself, you actually start to feel worse. Right now I'm 37 weeks pregnant, and throughout my pregnancy, I've pretty much thrown, my TRE, my time-restricted eating, out the window. Well, I do 12 hours, but usually I do 10. I try to do 10, sometimes 9. Particularly if I'm going to go for like a run in the morning or something that's endurance related. I like to eat within a shorter time window. But there are times that I can't even do there have been times throughout my pregnancy that I can't even do 12 hours, and I eat a little bit, after that. And I do notice it affects how I feel. I feel more lethargic the next morning.
So there is this food hangover that stays with you. It's almost like, as if the food stayed there in the stomach. It didn't get digested, or the stomach was sleeping when the food came.
Right.
And we get that response from many of our users, app users. That
from
use
My Circadian Clock.
My Circadian Clock app. There are many times when people, usually what happens is, for the first 2 to 3 weeks, people are very diligent. They try to do it and they get into that rhythm. And then we get this occasional feedback.
So that was again Dr. Panda explaining the effect on the hormones. So what finally they have summarized is that there are multifactorial benefits of this TRE in terms of reducing body weight, fat mass, blood glucose, insulin resistance, reducing the impairment of the beta cell function. The impaired fatty acid oxidation is reduced. There is a liver fat or fatty liver is reduced. Inflammation and oxidative stress are reduced. Blood pressure is reduced, and better sleeping quality.
So in with respect to diabetes, what is the helpful factor is that it initially causes the weight loss, even up to 1 to 4% from baseline, reduces fasting insulin and improves the insulin sensitivity in individuals with pre-diabetes and those with obesity. So it is a very good tool to start off with, especially those who are in the obese or in the pre-diabetic range, because it is easier to do. Even what the previous speaker was talking about, reversal or remission, those are all better if it is targeted in the obese subjects and in the pre-diabetic subjects. Then you have a better and a stronger chance of getting success. And moreover, it also improves glucose tolerance and decreases the serum glucose excursions. That means hikes or the spikes, what they call it. And these kind of proofs have come from various studies, both in the mice as well as in the human trials. So if you look at it in the mice, it acts via the circadian rhythm model as well as via the autophagic flux model. So you can see here that this early eating window is aligned with the circadian rhythm, and therefore it restores the phosphorylation, certain protein phosphorylations. I'm not going to the technical aspect much due to lack of time. It decreases the fed gluconeogenesis and increases gluconeogenesis and improves glucose homeostasis. The main here is the homeostasis part. It is maintained, doesn't let it go very low or very high, which is very important for the health, overall health, and to reduce the complications in a diabetic person. Then due to the increased hours of fasting, there is a down regulation of mTOR, which results in increased autophagy. All of you, I think by now, are aware of autophagy. And it also results in improved pancreatic beta cell function, which is again crucial. And in human studies also, they have seen that it works by metabolic switch. What happens is the body starts using fat deposits instead of your carbohydrates, mainly as an energy source. So this leads to mild ketonemia, and that enhances the cellular antioxidant activity, and that will help again because oxidative stress, and these are all major reasons for the beta cells to get destroyed. So indirectly now it improves the beta cell function, thereby enhancing the insulin signaling pathway and helps in preventing or handling the diabetes better. So this is a kind of summary of the overall effect of the TRE. So now, how far is this feasible or sustainable? So of course it is still happening, and there may be some issues or concerns about it. But overall, when we have looked at all the various studies and these results, we have summarized it in various tables in the book chapter, and we have seen that TRE has been reported to be a practical and a more feasible method in the real world setting. People have even tried it in the real world setting with human beings due to simplistic approach, because there's not too many restrictions and there's a little wider window, and there is a flexibility of having two to three different types of windows, which does not involve any form of course here it says any form of dietary restriction, but I would say not too much of strict dietary restriction. There should be a reasonable, and that doesn't mean that you can start eating junk food and say TRE and then I'll be happy. It means TRE with a healthy food or a normal healthy diet. That's what it means. And unlike other dietary strategies, the constant assistance of a dietary practitioner or nutritionist may be not required, because it's not a very strict calorie control or this control. With your normal healthy diet, you may be able to follow and still get a lot of results. So I've just end my brief presentation with this. Thank you. Maybe just any questions, one or two questions if it is there.
It's a nice presentation, madam, and informative. How about fasting? When we do fasting, then it is time restricted. From morning to evening we do. Then it becomes 12 hours.
Yeah, so even if you see any fasting, they try to follow the circadian rhythm, whether it is Ekadasi fasting or Ramadan fasting, they usually follow the circadian rhythm. That after the sun breaks and before the sun sets, that's why we do it. Even Ekadasi Vratam also we do that. It is basically it's following the circadian rhythm. But there you are trying to keep it very strict and for a longer duration. That is good, because that is like a detoxifying the body once in a thing, not on a regular basis. When we talk about TRE, we are looking at it as a daily lifestyle strategy.
Okay.
So fasting has its tremendous and important benefits when you do it maybe once in a year for a period of time, or when you do it once in a month or something. That is why we go for either Amavasya or this thing, because that happens every 14 days. See, automatically we can do that. So every 14 days you're detoxifying your body or something like that. So that is a different thing. So here TRE is something we are liking, trying
For
to see which we
diabetes.
can do it on a daily basis. At least 5 days in a week, if not daily. 5 days in a week is what people may target, because otherwise it won't be sustainable.
Oh,
So that is what is suggested.
okay, thank you.
Any other questions?
Saira ma'am.
During TRE, they don't. It is calorie restriction. Strict calorie restriction is not there. But that doesn't mean that you can eat how much ever you want. Though they say ad libitum, it is, I think, what do they mean is within your requirement. Like to say you are expected to take around 2,000 to 2,200 calories. That should be fine. They don't expect you to go down to 800 kilocalories or 1,000 calories, which is generally recommended in other conditions. Because the question becomes that calorie restriction, if you are following, automatically, if you want to eat only that much, you may be ending up eating only 1 or 2 meals anyway. So that is the thing. So one of the TRE, see, if you look at our human psychology, this time restriction to this 8 hours or 10 hours at the max is, then we kind of reduce on our munching or our extra eating hours. So that way itself they find that there is a lot of reduction in our intake. Some few calories reduction intake happens because when we restrict our time, we strictly, otherwise during bedtime snacking happens or late night snacking we tend to have when we are working or we are watching something, we tend to have that. So when you are going to strictly follow this window, then automatically there is a reduction in the total calorie intake. So it is a let us say subconscious restriction rather than a conscious restriction. So people are more happy to follow it. Or Yes. That's a non-calorie beverages and water. Non-calorie beverages and water can be taken, like lemon juice without sugar, just with a pinch of salt or something, or any water, mineral water or fruit water, and those kind of things can be taken. Infused water. Tea, coffee, again what happens, you'll add milk. If you're going for green tea, those things are okay. But again, milk and all if you add, then it's not counted as a beverage there. Permitted beverage.
Saira ma'am.
Yes.
Ma'am, my question is how is TRE different from intermittent fasting, ma'am? Because
if you go back to that slide, TRE is a type of intermittent fasting, okay, but without the strict restrictions of the intermittent fasting. So intermittent fasting, as you can see here, the fourth one, it is something like you have to keep it very strict. It starts at 12 and within 8 or 20. That means only 8 hours it is, or less than 8 hours. People even prefer 6 hours as the eating window. Here it is little more relaxing. 8 to 10 hours is the eating window, and you can have it at different times also. So that is the main difference. It means it's trying to see why these 3 different TREs they are giving is to, because all of us don't have the same circadian cycle rhythm, if I say. So some of us are more active in the morning, some of us are more active in the evenings, and so to suit to that you can do a flexibility is there. That's the main thing. So they're just trying to define it in 2 ways. One is in the time period. What is the time span which you have to do? Only thing is both try to do it within try to avoid the night period as much as possible. And second is it is a longer eating window. Okay. Third is there is no specific calorie restriction.
Thank you, ma'am.
Any other questions, or we can wind up?
Saira ma'am, ma'am, actually initially when we start this TRE, as the window is like 8 hours, if we like
8 to 10 hours you can. Better you
Yeah,
can start with a 10-hour eating window. Eating window 10 hours.
ma'am, so it's like from morning 8 o'clock to 6
6.
o'clock. After, in case if in midnight we get hungry or something, won't it cause any digestive tract issues like acidity?
No,
or
you have to
something?
go in slowly for it. Okay, and it takes, everything needs few days for the body to make a change, to adjust to the new changes. There will be some symptoms. Symptoms may happen and will happen, not may, it will happen. So you have to see how you can use it. Like, you will have to see if you can take a bowl of some non-calorie fruits or some vegetable salad and things like that to begin with. Though that will be like breaking the fasting period, but still some non-calorie or very low calorie, snacking can be done till you get used to that fact. So I didn't go into details here of that. So there are many other strategies which we can do. The last meal of the day, like for example, your 6 o'clock meal should be a very heavy one, which is rich in protein and healthy fats. That is one way of curbing the late night hunger and the hunger pangs. Okay, so there are many more this thing. Anyway, good you raise that point. That is a very critical and important thing, because if you try to make your dinner the lowest or the smallest, you will have trouble maintaining the TRE. So your lunch could be a very light one, but your dinner should be really a heavy one. Okay. Yes, ma'am.
Sarah, ma'am. Ma'am, just adding to that question, like when we are following the time restricted eating pattern, in between, as ma'am said, light lunch, in between the meals, we would tend to munch more of snacks, like the midday meal or which we have the bit snack. So would it
no problem. Actually, see, in TRE, what they say is overall your calorie, if you are taking care, maybe 2000 or 1800 kilocalories per sedentary woman, as we say. So it can be throughout from 8 o'clock to 6. When you eat, how you eat, it does not tell about that. So it will be as per your body requirement and window. Means ability to withstand, because some people don't want to eat for 3-4 hours, no issues for them. But some people, like if I want to go in terms of Ayurvedic terms, Pitta person, you can't tell them don't eat for 6-7 hours. They'll end up having many other troubles. So in that case, for them, after every 3 hours, something they may need to take a small amount of the food, or any mid meal can be taken. That there is no problem with that.
Thank you.
Okay, I think maybe we should wind up. I think there was a couple of questions from... Yes, ma'am. Yes, ma'am. That is preferable, but what studies have shown is, in case it is even, extends to 8 or 10, you start later also. That is all. See, always it is healthier to eat, the last meal should be as early as possible. But now in this modern lifestyle, when people have jobs only which is ending at 8 o'clock or 10 o'clock, then you tell them no, eat by 6, it becomes little. So people have done studies to see whether if they start the TRE later and then extend it to even 8 o'clock or 10 o'clock, does it work? And when we analyzed, we found that it is working. As long as you maintain that, because their circadian rhythm is changing. So then they should follow that. As per that, they should follow. That's that. If you are trying to end by 6 and you are keeping awake till 12, it will not help, because you are disturbing your circadian rhythm. So at such times, you are expected to go to bed by 10 itself. Yes. That is why we have given the 3 timings, ma'am. Approximately what the different studies people have followed when they have tried it with different people, they have tried to see these 3 time intervals. So if it is you are starting at 8, you should be able to end up by 6. If you are starting at 10, you should strictly end by 8. If you are starting your meal, that is starting to eat your food from 12, you should definitely end by 10. But I feel that ETRE and TRE are safer for any. Unless and until, as I told you, depending on your work schedule, you may have to go for the 3rd type. I think there are 1 or 2 questions. Will it affect the BMR rate of the person, or will it be normal? I don't think it will affect the BMR rate in any way, because we are not, BMR rate is based upon the type of the food you eat and the physical activity and so on and so forth, not the time of eating, as far as I know. Can liquid diets be used to follow TRE? Yes, you can follow, but again, you have to see that you are able to get nutrient dense, because in totally liquid diet, you will not be able to get nutrient dense. Maybe if you are going for a detox diet for 4-5 days, you can go for liquid diet. But then on the remaining days, you should go back to solid foods also.
And can it be flexible on daily basis? That is remains to be seen, because I have not found anybody who have studied whether, one day you do 10 to 8, another day you do 6 to 8. That remains to be seen, whether, having flexibility, whether you can mix up ETRE and DTRE, that still people have yet to study and do it. But maybe this is a very good idea for researchers to take it up, whether flexibility in TRE timings is a very interesting thing to look at. And so we will just, I think many more queries may be there, we will take it up. We maybe address it over the mail or something, since we are already lacking behind our schedule. And I think somebody else also had asked about why the doctors are not prescribing diet. So that is, as dietitian and nutritionist, even that is our sore point and our complaint as to why many doctors just give them pills and go on increasing the dosage of the pills and never advise. So that is why you attend these kind of conferences and dietary and nutrition conferences and gain some knowledge. And so go to a nutritionist or a dietitian and counselors, dietary counselors, and try to help from them apart from the doctors, even if they are not telling. So that would be our advice. And even as, again, I think Dr. Labani among the audience has pointed out that, the medication, the dosages vary from company to company. So that is all not in our hands. So it is best is to look at your bed profile. So, that is, we need to keep checking every 3 months, or, especially in the case of blood glucose, you can do it every time, so that when you are shifting from one pharmaceutical company or one brand to another, it's always advisable, one insulin to another brand of insulin, better check what is it's happening, because some may be more effective for you, or the company's medication is less efficacy, and you may think that same 10 units I can take thing, it may happen. That is why the doctors also, if they are changing any medication, they'll ask you to get back within 15 days or 1 month and look at your levels. So that is the reason, and we may think that why the doctors are simply calling us, they want to earn money. But it may not be so. It is for our own self we have to. Whenever we are changing any regime, whether it's dietary regime or physical activity regime, or if it is a medical pharmaceutical products we are changing, or we are adding on some of the allopathy medications, either it could be Ayurveda or some herbal treatments, or we are trying at our home, all that will also impact. So we should be advised to check our levels and our symptoms, and then only proceed. So I thank everyone. Sai Ram.
Thank you so much, ma'am, for enlightening us on such a interesting topic, time-restricted eating, and giving us practical approaches and answering all our questions. Students are more curious to know about it and are having many more doubts. We can see for it later. And thank you so much for an enlightening talk. Now I would request Dr. Sumana Madam to address us with the concluding remarks.
Om Shri Sai Ram. I offer my humble pranams at the lotus feet of our founder Chancellor Bhagwan Sri Sathya Sai Baba, respected members of the Institute, Director Madam, colleagues, respected elders, research scholars, and dear students. World Diabetes Day is celebrated every year on November 14 to mark the birthday of Sir Frederick Banting, who discovered the insulin hormone with Charles Herbert Best in 1922. World Diabetic Day was established by the International Diabetes Foundation and the World Health Organization in 1991 as a response to growing concerns about the escalating health threat posed. It was officially recognized by the United Nations in 2006 with the passage of resolution to this effect. The significance of celebrating this day is learning about the diabetes mellitus disease and actively participating in the treatment are important since complications are far less common and less severe in people who have well-managed blood sugar levels. Thus, this symposium, I quote, "Know Your Risk, Know Your Response," is an event conducted to encourage people to be aware of diabetic mellitus and disorders so that they can benefit from the education that has been imparted and the research that has been translated with effect. As we draw the curtains on this enlightening Diabetes Day Symposium, we find ourselves enriched with the wealth of knowledge and insights shared by distinguished speakers. Dr. M. Srividya, Head Department of Food and Nutritional Sciences, set the tone for the day with a warm welcome note, creating an atmosphere of collaboration and shared learning. Professor B. Andallu's comprehensive overview of diabetes mellitus illuminated the multifaceted aspects of the prevalent health concerns, providing a foundation for the subsequent discussions. Mrs. Ira Rattan, a beacon in the field of diabetes education and nutrition, delivered a keynote address that not only captured our attention but also offered hope with her explanation of reversal and normoglycemic remission of type 2 diabetes mellitus through natural food. Her insights into the transformative power of dietary choices left an indelible mark on our understanding of managing diabetes naturally. The symposium reached new heights with Professor N. Srividya Madam's exploration of time-restricted eating and metabolic syndrome. Her expertise in the intricate relationship between our eating patterns and metabolic health provided further vision on the TRE concept and has erased our doubts on intermittent fasting. Madam has provided a fresh perspective, opening avenues for further research and practical applications in the management of diabetes. In the words of our founder Chancellor Bhagwan Sri Sathya Sai Baba, I quote, "Every effort should be made to keep the human body healthy. Health is wealth. Wealth cannot be enjoyed by a person with poor health. The secret of perfect health lies in keeping the mind always cheerful, never worried and never hurried." Unquote. In conclusion, the symposium has been a journey of discovery and inspiration. We express our heartfelt gratitude to all the speakers for their invaluable contributions and to the audience online and in presence here for their active participation. As we depart from the symposium, let us carry the torch of awareness, education, and innovation to illuminate the path towards a diabetic-free world. I thank the university administration for giving us an opportunity to conduct the symposium. I thank our director, Professor N. Srividya Madam, for taking up the initiative and encouraging us to go so. I thank the faculty, Department of Food and Nutritional Sciences, the research scholars for their efforts in conducting this symposium. I thank the students and all the viewers who are listening to us online for their patient listening. And I thank, last but not the least, I thank our founder, Chancellor, for giving us an opportunity to share the message with everyone and lead them on a road to good health. Thank you, Sairam.
We shall end the session with prayer. Om Shanti. Shanti, Shanti, Shanti. Jai Bolo Satya Sai. Jai Bolo Sri Satya Sai Bhagwan ki Jai.